I think I'm good, so. Oh, can you take down the candelabra?
The what?
The candelabra and those candles. I like a rock up there. Like this rock. These big rocks. Yeah, that one. The top one. But you're gonna take down the candelabra. Let me mute. Hi, Jenny. Hi, Jamie. Ashley, are you on? Who is that at the bottom? I see. Probably Naomi. Amy Schroeder's on.
Yeah, I'm on.
Naomi.
Naomi.
I don't know.
Hi, Naomi.
All right, Mr. Vice Mayor, if you'd like to call your meeting to order.
Good morning. I'm going to call this meeting to order and start off with the Pledge of Allegiance. Ms. Newby, if you would do us the honor.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Mr. Vice Mayor, your first item today is roll call for the Reno
I'm
City
not sure
Council.
whose email we are looking at, but they order an awful lot of Jimmy John.
As a reminder to everyone who's on the Zoom call, please mute yourself unless you are a council member at the time, as we will now be transitioning to roll call for the Reno City Council. Breckus. Breckus is absent at this. She is present. Councilmember Breckus, we can see you on the Zoom. Can you hear us?
Let's mark her as here, please, and then continue with the call.
All right. Breckus is present. Dewar? Dewar? Everyone who is not a council member, please mute yourself at this time.
Councilmember Dewar, are you able to hear us, and can you wave? Maybe? Okay, we're going to take a brief recess while we figure out some IT issues on our end, so stand by, please.
Bonnie, I'm coming in loud and clear.
Okay, good. I thought
I think they've just muted us from the council chamber.
Okay.
We can hear you.
Okay. So what we have done, we're in pause for the stream at this point. We have muted everyone on the call because we have 27 people on the call and everyone is talking. So we've muted everyone and are in the process of unmuting just council members so we can get through roll call and try that again. So if all council members can be ready to go, we're gonna call you back to order in just a second when I call your name. Okay. Mr. Vice Mayor, resuming roll call for the Reno City Council. We will try this again. Breckus?
Here.
Thank you. Dewar?
Here.
Delgado?
Here.
Weber?
Here.
Garden? I can see that Councilmember Jordan is on and she is working out her mute button. Reese?
No, I said here.
Here.
Oh, Okay, Jordan, we have you on, and then Shivi.
Here.
Thank you, Mr. Vice Mayor. You do have a quorum of the Reno City Council. At this time, your next item on your agenda is public comment. As a reminder, all public comments have been received either via email, online through our form, or through voicemail, in which has been submitted to council for the record. I would like to note that we received general public comment from the following persons: Alice and Michael Badrika, Leslie Greenberg, Mary Durant, Jake Jones, Richard Martinez, Debbie Lamon, Isabel Takahashi, Lori Leonard, Tamara Teal, Marika Moore, and those have been submitted to council and are part of the record today. With that, Mr. Vice Mayor, you have no further general public comment, and we will transition to the approval of the agenda, in which I'll turn it over to the city manager for any changes.
Thank you, Madam Clerk. I do have 2 changes. I have deletion of A53 from the minutes section. And also, just to note, item D6, which is the report from the district health officer, shall be at 10:30 a.m. time certain. Those are the only changes I have.
Okay, thank you. May I have a motion to approve the calendar, or I'm sorry, the agenda?
So moved.
We have a motion by
Dewar.
Councilmember Dewar. Can I have a second?
Second.
Second by Councilmember Delgado. Any further discussion on this item at this time? Hearing none, I have a motion and a second. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed, please signify by saying no. Motion carries unanimously.
Mr. Vice Mayor, our next item is approval of the minutes for March 3rd, March 4th for the 10 a.m. special meeting, and March 5th.
Okay, may I have a motion, please?
So moved.
Okay, I have a motion by Councilmember Dewar. Do I have a second?
Second, Jordan.
Councilmember Jordan, thank you. Any further discussion on this item at this time? Seeing none, I have a motion and a second. All those in favor, please signify by saying aye. Aye.
Aye.
Aye.
Any opposed, please signify by saying no. Motion carries unanimously.
Mr. Vice Mayor, your next item is the consent agenda. I would like to note for the consent agenda that we received online public comment from Dora Uchel Martinez for the item for B4. This has been submitted to council and is part of the record. With that, I'll turn it over to you for items to be pulled by council members for discussion.
Okay, thank you. I'm going to go by ward. Councilmember Breckus, are there any items that you wish pulled for discussion?
I'd like to pull that item B4 and item B3.
Okay, items B3 and B4. Okay, thank you, Councilmember Breckus. Councilmember Dewar.
Nothing. Thank you.
Thank you, Councilmember Delgado.
Nothing on mine, thank you.
Thank you, Councilmember Weber.
Nothing, thank you.
Thank you, Councilmember Jordan.
Nothing, thank you.
Okay, and I have nothing. Madam Mayor, do you have anything to pull from the consent agenda?
No, Vice Mayor, thanks.
Okay, may I have a motion on the consent agenda items not pulled for discussion?
Move to approve the remaining items, Jordan.
Okay, I have a
Dewar,
motion by
second.
Councilmember Jordan and a second by Councilmember Dewar. All those in favor, please signify by saying aye. Aye.
Aye.
Aye.
Any opposed, please signify by saying no. Motion carries unanimously. Item B3, Councilmember Breckus.
Yes, I might have missed the what was sent to us from the public comment, and if I understand, it was from Dora, who's someone I've worked with for a long time. She represents generally the concerns of the blind community, and I'm just wondering if that could be read into the record. I might have missed it coming through the emails.
Madam Clerk?
I can let you know this came through the online public comment form. Dora says she would like to take this opportunity to thank those folks who made this public comment form accessible. However, please make the reCAPTCHA more clearer. As a blind activist, I'm grateful for the efforts. I'm in favor of item B5. I ask that when placing the bike rack and benches that they would be in compliance with ADA and that they would not interfere with the sidewalk and other public pathway. So no position
Okay.
stated.
Okay, so maybe where are these going to be placed so that they aren't in the way of the blind when they a lot.
Councilmember Breckus, can
Number of tap along.
Councilmember Breckus, we're on item B3, and so I don't know if we're talking about the same thing, and that's why I'm confused. B3 is the award of contract for Spanish Springs construction for Mayor's Park 2 phase improvements.
Oh, I beg your pardon. And I misordered because the first comment she meant was the public comment, and then I pulled that one first.
Oh, okay.
So my question to the Public Works Department, and maybe for the greater good of order, is perhaps for these projects that are going to go on this spring and summer and fall, maybe the council and the Public Works Department wants to consider having a rider in these contracts that the contractor will provide a COVID compliant social distancing policy and practices so that we can make sure that they're out there doing what needs to be done in terms of making themselves safe. I think when we send our own workers out there in the field or people working in our right-of-ways under our contracting authority, they're very visible to the public. And I think we need to ensure that the public sees that we are taking this very seriously in terms of what needs to be done to separate people so they're not, when they're on these essential job sites, mixing and mingling and spreading potentially the COVID. And I've also been reading some concerns from just the general public at large that there's concerns about some of this workforce activity. So I just wanted to bring up that maybe we put a rider into these, that they have to bring to the Public Works Department clear expression of how they're going to comply with any guidance, and then also puts them on notice that our inspectors will be looking to make sure they're following that.
Councilmember Breckus, you make a very good point. I'm going to see if John Flansburgh is on, or maybe Carrie Koski. Let's just see who's on that could address your question. I think you make a very good point, and obviously we want to be leaders by example, and so thank you for your wise counsel. Can I just take a second to look at who's on the call? There we have it. Okay.
Can everybody hear me okay?
Yes, Mr. Flansburgh, the floor is yours.
For the record, John Flansburgh, Director of Public Works. Very good question, Councilmember Breckus. We actually go through the OSHA guidance. We have been working with the contractors on ensuring that the OSHA guidance is covered, and that would be the correct regulatory body for the COVID-19. So there isn't anything specific that I would recommend putting into our contracts, because our contracts are already required signatory to the OSHA requirements. And that is where those are being handled. And they can move more nimbly, because when OSHA provides additional guidance, then those are directly applied to the contractor.
Yeah, I'm not really comfortable with that. I think that in the governor's, there was a question yesterday in the governor's conference that, OSHA is not even doing field inspections. And I really believe that we are in an overlapping world of authorities, but I want our authority for people who are doing work for us to be very clear, both our staff and for those who are contracting to us. And I'd like to have it on the checklist of your inspectors when they go out.
Yeah, thank you. We actually are checking for that in the field, and OSHA is in the field. In fact, OSHA has levied some fines to some of the contractors. None of the ones working on our contracts to date, but they are out there and they are issuing those fines. So there is regulatory oversight, and we are also following that guidance, and our inspectors are going out and ensuring that those are being followed.
Okay, well, I will let this go this time, but I'll tell you, I'm not comfortable what I'm seeing and hearing out there from the contracting world, and our own field operations. And so maybe we just need to, I'll be keeping an eye on it.
Thank you, Councilmember Breckus. Can I get a motion, please?
I'll move.
Okay, I have a motion and a second,
Second.
please. A motion by
From
Councilmember
Dewar.
Breckus, second by Councilmember Dewar. All those in favor, please signify by saying aye.
Aye.
All right.
Any opposed? Motion carries unanimously. Item B4, as pulled by Councilmember Breckus.
Yes, and this was about the public comment about the blind. These artistic installations, how are they specifically meeting the ADA requirements for the blind as they tack along the sidewalks? Are they easily discernible?
Thank you, and I think we have...
Councilmember Breckus?
Yes, there we have, Ms. Hill is on the phone with us today. Thank you. The floor is yours.
Absolutely. Great question, Councilmember Breckus. We worked with the Parks Department and Public Works Department to ensure that these artistic benches and bike racks were ADA compliant, which meets the blind and both the physically disabled. Additionally, on the placements that you're asking, which is a great question, we have been working with RTC, Public Works, and the Midtown Design Review Committee, and have placed these tentatively on a map of where they will go, and have been working with the businesses to ensure that they're happy with the placement. We didn't put it in the staff report because we don't want those to be set in stone, but it is a process that we've been working with the community on.
Okay, well, thank you. I just know sometimes they span a distance, the bike racks, so they're not as easily tappable, and then they're not tall enough, and people can trip over them. So I just, wanted to make sure that we have the ADA experts from us and RTC really clued in on her concerns, because she is always accurate on what she represents, in my experience, on the challenges that are out there in the real world when, because she's a user. So, okay, thank you.
I think you bring up great points, and I can ask the clerk to send her email to me, and so I can ensure that we're working with her.
Okay, thank you.
Ms. Hill, before we move off, happy birthday to you. I know it's a difficult time to be celebrating, but we wish you the best on your trip around the sun, and thank you for being with us on the call this morning. Councilmember Breckus, can I get a motion?
I'll move.
Okay, I have a motion by Councilmember Breckus, a second by Councilmember Dewar. All those in favor, please signify by saying aye. Aye.
Aye. Aye.
Any
Aye.
opposed? Motion carries unanimously.
Mr. Vice Mayor, with that, we are on our first 10 a.m. public hearing. This is item C1, which is a bill introduction for Charlene's Business Resource Center PUD amendment.
Okay, let the record reflect that the City Council is opening the public hearing on item C1, case number LDC 20-00038. Madam Clerk, was proper notice given
Mr. Vice Mayor, proper notice was given.
and any correspondence received?
We received correspondence, one letter in opposition from S. Garcia, one letter of concern from Janet Stitch. These have both been entered into the record and have been submitted to council.
Okay, and for the record, I have read them. I believe each of the council members received them. Thank you for the correspondence acknowledgement. Let's start by asking, do any council members need to make any disclosures at this time? Okay, hearing none, I'm going to invite our staff presentation forward.
This presentation will be handled by Angela Fuse from staff.
Thank you, Ms. Foos. Welcome.
Good morning. For the record, Angela Foos, Acting Community Development Director. This is a request for a zone change or a PUD amendment as part of the Charlene's Business Resource Center handbook. And one moment, please. Okay.
Ms. Foos, while we're queuing that up, might I just note for the record that the applicant is present and does not have a presentation to make, but is available for questions. That's why I wanted to get the staff presentation on first. So the floor is yours.
And he is
Okay,
present
so this
via
is
the
a-
Zoom call, just to be clear. And at this
This is
time,
Angela,
Angela, you should have control.
Okay, thanks everyone. This is approximately a 2.5 acre site. Again, this is part of an existing PUD that was approved back in the early 90s. They are requesting a change on this one site. It is south of Charlotte, kind of sandwiched in between an area that has apartments both to the east and the west and single family to the north, and then open space on the immediate west. The request is to, oops, we lost it. Is to modify the uses that are allowed. So initially when this site, this PUD was approved, it was allowed for what was going to be a Boy Scout office, and it was owned by the Boy Scouts facility for a number of years. At this point, it looks like the property owners are going to be changing, and the new owners come in, so they're asking to come in with the option to do neighborhood commercial type uses or multifamily uses. This PUD amendment includes a handful of changes that, again, make it consistent with a typical N2 zoning, neighborhood commercial zoning, or if they choose to do a multifamily zoning. But other than that, it was consistent with the development around it. It was unanimously approved by the Planning Commission. And from a public comment perspective, we've had a couple calls to the planner just asking about the amendment. And other than the one letter of opposition, we have not had any opposition, at least calls or emails to us as staff. And with that, I'm available if you have any questions.
Okay, I'm going to ask if there are any questions for the staff or the applicant. Council members.
Yes, this is Councilmember Breckus. This is in Ward 1. I understand the request, and I think it's a sensible request because the specificity of the existing use is it's kind of oddball. But when we issued the annual road program to rebuild Ambassador a couple months ago, maybe about a month ago, I expressed concern that I think the public commenter, the neighbor within its 750 feet is also expressing, and that's about the safety of Ambassador. And Ambassador has some speed bumps up higher, and I had asked for speed bumps lower, closer to Charlotte, presumably where this new use will be generating traffic, to be considered and installed. And then I saw Public Works photos that the project's under process and had not heard that anyone had responded to that concern that we do some neighborhood traffic calming on Ambassador. So I was wondering if the Public Works Department could let us know what's going on in this vicinity so that the public, the person who's in opposition could also know that we're taking measures to improve safety in that area.
And we can pass that message along to the Public Works Department.
Isn't the Public Works Department on the call?
Mr. Flansburgh, I think you're still on the call. Give us a second, Councilmember Breckus, just to see if Mr. Flansburgh can come to the mic.
Yes, I am here. Can everyone hear me?
Yes, thank you, Mr. Flansburgh. The floor is yours. Councilmember Breckis's question has to, if you heard it, I hope.
So in regards to Ambassador, we do have a project out there. Councilmember Breckus, you had inquired regarding potential traffic calming. We would need to get with, review that route for traffic calming. I'm not quite sure what it has with this particular project.
Well, this is in proximity, and an individual is within 750 feet has expressed concern about that. And when we awarded the Ambassador project about 6 weeks ago, I did bring that forward and followed up with an email with you, and just waiting to hear how that's going to be handled. And then that can allay, I think, some of the concerns of the traffic generated by this amendment.
Yeah, we will be in touch with you on that, but we do have that process we go through, and obviously working with all the residents in the proximity because the traffic calming, as you know, some are for and some are against.
Yes, but if I might add, that's a different process. this process is a redesign just like anything else, like Midtown and so on. So I think that the design considerations that I've raised, the concerns that this person's raised, should be considered at this point while we're rebuilding this street.
Thank you, Councilmember Breckus. Do any of the council members have a question of the staff, or I suppose the applicant? I'll just say for my part, because this is the neighborhood I grew up in and currently live in, I think this is an excellent opportunity for this change to be made, and I also think the traffic impacts will be minimal. I appreciate Councilmember Breckus's concerns about Ambassador, and I have noticed the crews going out and the project being started. So let's make sure that we circle back with Councilmember Breckus on that. But I have no concerns at this time. Any other council members on the phone wish to weigh in? Okay, hearing none, I'm going to ask Councilmember Breckus for a motion, please.
Yes, I will motion to, let me just get it here. Oh, I'm sorry. I think it's a referral, the second reading.
Mr. Vice Mayor, I would like to have the city attorney read the bill number at this time.
Great, thank you.
This is ordinance introduction, bill number 7137, case number LDC 20-00038, Charlone's Business Resource Center PUD amendment, request for an amendment to a planned unit development handbook to convert plus or minus 2.44 acres from a professional office use to neighborhood commercial and multifamily uses. The site is located within Charlone's PUD zoning district and has master plan land use designation of suburban mixed use. The plus or minus 2.44 acre property is located on the south side of Charlone's Avenue and plus or minus 1,600 feet west of its intersection of Ambassador Drive, Ward 1.
Mr. Vice
Did
Mayor, with
everybody
that?
hear me?
Yes.
Yes, thank you for that.
Okay.
Councilmember Breckus, I'll return to you. At least in my queue, it shows the proposed motion as upholding the recommendation of Planning Commission, but I'll leave that to you.
Yeah, I'll uphold the Planning Commission recommendation.
Okay, I have a motion by Councilmember
I'll
Breckus
second,
and a
Weber.
second by Councilmember Weber. Thank you for that. All those, any other further discussion of the motion? Hearing none, I'll call for the question. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? Motion carries unanimously.
Mr. Vice Mayor, with that, at this time, we have Kevin Dick on the Zoom call from the Washoe County Health District. So I would recommend that we transition to item D6 for his presentation along with Sam Hicks regarding the COVID-19 pandemic.
Thank you, Mr. Dick and Mr. Hicks, for being here. The floor is yours. Happy to have you here today.
Thank you very much, Vice Mayor Reese. This is Kevin Dick, District Health Officer for the Washoe County Health District. And I want to thank the City of Reno and the entire council and your staff for your partnership in our regional response to the COVID-19 pandemic that's occurring. I do not have updated numbers of cases yet today, but I can provide you with the update of cases that we reported yesterday. We reported 22 additional COVID-19 cases. That brought our total cases in Washoe County to date to 684. Sadly, we've had 18 residents who have passed away from COVID-19. We have 175 of our residents that have recovered from COVID-19. That leaves us with 491 active cases in Washoe County. We have 41 of those individuals are hospitalized, and 42 people that have been hospitalized have been released from the hospital. So those were our statistics as of our last report yesterday. The hospitals remain with good capacity. They have 57% of their licensed and staffed acute care beds occupied, 53% of their ICU beds occupied, and 24% of their ventilators in use. So we're pleased that we're seeing this continued capacity from the hospitals, and that our curve is flattening as far as the number of new cases that are being reported. This was the intent of the social distancing measures as a mitigation strategy to help prevent the spread of COVID-19 so that we didn't experience the type of surge numbers that were projected earlier as this pandemic was unfolding. So that's all very good news for Washoe County as far as how we're coming through this with the sacrifices that our citizens are making to fight this disease. We continue to conduct testing. We operate a call center where people can phone in 328-2427 if they have any symptoms of COVID-19. There's also a risk assessment portal through our website where they can do this over the internet and be scheduled for testing. Yesterday, REMSA fielded 160 phone calls, and we had 151 risk assessments conducted through our website. Of the ones coming through our website, 131 of those were automatically scheduled for COVID-19 testing. We have a Spanish language risk assessment available on the website, as well as bilingual staff that are available through the call center. So we are encouraging everyone to please contact us or visit our website if you have symptoms of COVID-19 so we could get you scheduled for testing. And that occurs through a drive-through post that we operate at the Reno Livestock Event Center. And we have collected samples from up to 300 people a day through that drive-through post. We operated it on Monday, and we had 217 individuals tested. And we're operating it again today, and we expect to have 200 or so people tested. The number of calls that we're receiving and the number of people that are that have symptoms that are contacting us seem to be declining, and we're not scheduling or filling that post to capacity at this point. We did have a call with State DEM yesterday to talk about expanding testing capacity, and we'd already been discussing this internally. We've been having all of our tests conducted at the Nevada State Public Health Lab, and Dr. Pandori has done an excellent job as director of that lab with being able to continue to procure the materials necessary for running the tests, but also to be able to manufacture test collection kits for us, the swabs that are in very short supply nationally, to keep us supplied to be able to continue with our testing. They are working on being able to manufacture with 3D printing swabs that can be used for the test collection. They're working with the med school on that, and they are currently assessing the quality, doing some quality control and tweaking the design, is my understanding, of those swabs. They're not yet deployed in the field, but we're hopeful that that will provide us with a continuing resource for doing the testing. The call with DEM, also they communicated to us that they expect to have a lot more test capacity occurring through University Medical Center down in Las Vegas, where they would be supplied with the tests through Arab Emirates. And so they're expecting to have much increased capacity, and they asked that we statewide ramp up to a level of 4,000 tests per day that we collect. So currently, looking at the data over the last week or so in Washoe County, between the health district's post drive-through collection event and the testing that's occurring through our healthcare providers, we have about 240 tests per day that are being collected in Washoe County. So if we ramp up to the 4,000 tests statewide, that would be about 600 tests per day based on our population here in Washoe County. So we are currently working on developing plans for how we can achieve that level of testing between our post and with the healthcare providers. Our intent is to plan for a process in which we operate the post every day. Right now we operate it Monday, Wednesday, Friday, and Saturday. That allows us to be able to conduct the scheduling for the post drive-through, to prepare all of the paperwork and labeling to get it all organized and ready for people to minimize their time and contact as we do the drive-through test collection. And it also provides for us doing the notification of positive and negative test results to the individuals and following up with case investigation and contact tracing with people that are positive and folks that they've had close contact with. So in order to do the testing every day, we need to increase our staffing, and I've made a request through the county to take over some more space within the county complex and have more phones and computers to support that work. We're fortunate that we've had the National Guard join us and are integrating into our operations. And so they're now actively working with us for the posts and the sample collection that occurs there. I talked about our flattening of the curve, and we've been looking at some different models that have projected when the peak with COVID-19 may occur in Nevada and here in Washoe County. And these models have differed significantly in what they have projected, and they have changed over time. So they've gone from in the past projecting that we were going to far exceed our capacity in our healthcare system based on continuing increase in cases that would occur in Nevada and Washoe County. Fortunately, that's not what we've seen as the proactive social distancing measures have gone into effect. And so that's why we have placed the build out of an alternative care facility that had been planned for the Reno Sparks Convention Center. That's why we put that on hold, because at this point we don't anticipate that that's going to be necessary for our community. One of the models that we think is tracking most closely with what we have happening in the state of Nevada is the Los Alamos National Labs model. And if people were able to see the governor's briefing yesterday, you saw some presentation on some of these different models. That Los Alamos model told us last week that there was an 80% chance that we had experienced our peak as of the 15th of April. They revised the model and updated it on Monday, and it says fairly close to that. It says 82% chance now that we had experienced our peak by the 19th of April. It also has probabilities for if we have not yet hit our peak as far as new cases being reported on a daily basis, when are we likely to hit that peak? And the model is now telling us that if we haven't hit the peak by now, there's about a 27% chance that we'll hit the peak this week. And about, if we don't hit it this week, about a 22% chance that we'll hit it the following week. So this model indicates that we're around our peak or maybe just past it. And that seems to be what we're seeing with our data so far. So we're cautiously optimistic that we have moved through the peak, or that we're in that peak type of timing for our area. But we need to continue to watch this data over a period of time, because with the population size of our community and the number of samples that we're collecting, these can vary from day to day, and we need to make sure that that's a continuing result that we see of declining numbers over time. The other message that's tied with us being at our peak, the good news about being at the peak is if we're at the peak, then we're not continuing to see more and more and more increasing numbers of cases occurring on a daily basis. But the bad news about being at the peak is that means we have the most cases that are occurring in our community that we're testing and diagnosing on a daily basis, and that means that we're at the greatest risk of spread while we have that number of cases happening on a daily basis. So we really need to urge everybody in the community to continue to be vigilant in following the social distancing practices, and to not go out unless there's an essential need for people to leave their homes, to cover their face with a cloth covering when they are out, to be observing the social distancing measures, particularly if they are in an essential business or they're visiting a business or other location where they're interacting with others, the hand washing and the cleaning of high contact surfaces frequently, all very important that we are observing right now so that we can actually see the benefit of all the sacrifices that we've made to see those cases continue to decline so that we can be in a position where we can begin reopening our economy. So moving forward, as we are reopening the economy and more people are, and businesses are open and people are out, it'll be very important to continue to work on social distancing practices and that hygiene and prevention of spread of disease. But it will also be very important for us to be able to quickly identify if there are new cases occurring so that we can use our traditional public health approach of identifying the person that has the COVID-19, doing that case investigation with them to identify everybody that they've had close contact with, so then we can do the contact tracing to contact all of those individuals, work with them to remain quarantined for 14 days through the incubation period to see if they develop symptoms and develop the disease, and to work with the case, of course, to be isolating until they're recovered. So the work that we're doing now to ramp up our testing is part of that effort. We'll also be working to increase the staffing that surrounds all of the work that's involved in conducting the tests and the contact tracing. And there have been several papers that have been put forward. Johns Hopkins worked with ASTHO, which is the Association of State and Territorial Health Officers, And they are estimating that we'll need about 100,000 case contact investigators nationally. That number, if we scale it for our population here in Washoe County, is about 140 case contact investigators. So that's an army of people. There are other estimates that we need even more than that. So we'll see how, as we move through this, where we end up. But the NACCHO has also got a paper with a similar number of about 30 case contact investigators per 100,000 population. Both ASTO and NACCHO is the National Association of County and City Health Officers. Both ASTO and NACCHO in their papers have a federal funding request of $3.6 billion to support that case contact investigation staffing. We haven't received any of that money yet. The legislation that's happening back in Washington, D.C., my understanding is includes $25 billion for testing. And so we'll be working to see if that money is available for these other tasks that go along with effective testing for our population. The governor last night outlined his path forward and laid out some different phases for reopening our economy. And so he identified that the first phase is what he's calling phase 0 that we're in now. And that is a consistent and sustainable downward trajectory of COVID-19 cases and hospitalizations over a 14-day period, measured by a decrease in the trend of COVID-19 hospitalizations and a decline in percentage of people testing positive. That healthcare and public health systems should be able to maintain hospital capacity without crisis standards of care, have a sufficient public health workforce capacity between local and state health departments to conduct case contact tracing, and have the expanded ability for healthcare providers to administer tests for symptomatic patients and have sufficient laboratory testing capacity to process COVID-19 testing samples. We also need a sustained ability to protect vulnerable populations, meaning that outbreaks are successfully contained and closed in special settings like health facilities and nursing homes, and to confirm protective measures are in place before moving to that first phase of reopening. He also identified that they would be developing specific guidance for different types of businesses that might be reopened in the first phase and following phases, and that through the first phase, that public gatherings of 10 would be limited to 10 people or less. So he provided some of the parameters for us moving forward. Now, as far as vulnerable populations and the testing that occurs there, I should also note that we have procured sample collection kits and testing capacity from a commercial lab in Southern California. And we've received our initial shipment of about 2,000 test kits that we can use for testing in locations where we're seeing clusters that are occurring. We're working through a process with the state right now, between the state and this lab, because they have to be able to report their test results to the state prior to us being able to use them and these test kits. So we're hopeful that we'll have this resource available soon to be able to allow us to respond to clusters where they're occurring in the community, which would include not just sampling symptomatic individuals, but being able to go and sample everybody, collect samples from everybody and have everybody in a long-term care facility tested, or if we have a warehouse where we're seeing a cluster of cases occurring, or a construction contractor, et cetera, would allow us to collect samples from asymptomatic and symptomatic individuals to really try to close down any outbreak quickly as it occurs. So sorry to ramble on for a while. There's a lot going on with this response, and Commander Hicks has also additional information, so I'll wrap my presentation up there.
Commander Hicks? Oh. Commander Hicks, I'm not sure if you're still with us because I know you had an 11 o'clock call. Can I just see if you are still with us, Commander Hicks? I think we're going to make an assumption that Commander Hicks is not on the phone. He had another call to make with the state. And so, Mr. Dick, if you would just be with us.
Kevin, is Sam Hicks here?
No.
I can't tell. Sam, are you available?
Yeah, I think folks on the
He
phone.
doesn't look like he's logged into the.
Councilmember Dewar, can you hear me?
Good morning, this is Sam. Can you hear me now?
Yes.
Yes.
Sorry, my phone, I guess, wasn't working. I just have a couple of minutes really quick to add to, Kevin covered most everything. I did want to talk about Edison Housing, and that should be fully functional and running by Thursday night, Friday morning. All 300 units will be ready to go. It'll be a turnkey operation. There's a matrix for people to get in there if they need to, that the housing division has vetted out. So it'll be functional. There's rooms available now, but the whole thing will be ready to go by Friday, probably midday. The other thing, Kevin talked about the ACS, so I won't touch on that. Our big thing is working with the state on testing now to see what that looks like and how we're going to implement that as we move forward. That's about all I have. Is there any questions, or I need to log off?
Council
I
members.
do have a question. This is Councilmember Breckus.
Councilmember Breckus, hold on one second. Mr. Hicks, can you tell us, I know that you had another call that you need to be on, and so I want to just be respectful of that fact. Do you have a minute to answer a question from Councilmember Breckus?
Yes, sir.
Okay,
Go ahead,
Councilmember
ma'am.
Breckus.
As the transition plan takes place with the stand down of the incident command, and then it is moved to the home jurisdictions, who will be overseeing the homeless branch and who will be overseeing the housing branch?
So 2 parts to that. We have a meeting this afternoon with the agency administrators to talk about our transition. And depending on the testing, we may have a small team that stays in place. So we won't fully transition back to local jurisdictions as we had planned on Wednesday of next week. As it stands right now, the homeless branch, as well as the housing branch, will go back to the day job people that are normally functioning in there. Julia Ratty would go back to her day job per se. There's not a lot that we're doing to support that other than water and some logistical facility stuff, outhouses, things like that. But that's on a reoccurring basis. It's already taken care of. It's self-sufficient. The housing matrix is in place, and I believe Katrina and there's one other person that will monitor that. And we have a management company on site that kind of takes care of the facility itself and all the wraparound services. So it would go back to, Katrina and Frankie, I believe, are the 2 people that would kind of manage that. There's really not a lot for us to do as far as the team goes in managing that because it's set up to be somewhat self-sufficient with oversight from those folks. Does that answer your question?
I don't know. Maybe I'm not sure. I mean, I'm still trying to figure it out and what are the roles and responsibilities of each of the branches. Maybe there's a mission statement of those, but we can take that up with our city manager. But because what I've seen are contracts, intergovernmental contracts, which you would think under those would then assign responsibility ongoing, principal people monitoring those contracts. So thank you, and I understand you have to leave, but thanks for that update.
Yes, ma'am.
Thank you. I'm going to transition to Councilmember Dewar. I know that you had some questions for Mr. Dick.
I did, thank you. First of all, I just wanted to express thanks on behalf of all of us for what you've been doing. I know this has been a very long push, and it seems almost to me that you've been there 24/7. So I'm sure you have some backup, but it's been good to have you and the whole team working. Mr. Hicks, if you're still on the phone. I have a few questions, and I did have an opportunity to listen this morning, and one of the things that I've been wondering is, we've heard a lot of numbers, but I just haven't had a chance to see any graphs. I know you have models, but do we have any simple graphs that would just kind of show the ramp up of cases over time and where we are, so maybe we can understand this visually?
We're actually working on expanding our dashboard to provide the graph that would show you the daily case count and how that has changed over time. So I don't know if it will be up today. I'm hopeful that it will, but we're working to get that up. What we're doing is similar to what you heard described if you listened to the governor's briefing last night, is to track a 7-day rolling average of the daily case counts, because with the variation that you have day to day, it's hard to make sense of quite a jagged graph that you would get otherwise. So we use that to smooth it out. And as I said, hopefully we'll have that on our website today or very soon.
Usually on those graphs, they usually have both. They'll have a bar chart or something showing the case numbers, and then they'll have a smoothed out graph function showing, the trend. So maybe you can have both. I have a few questions just to follow up. You mentioned that you're ramping up testing, and I think that is, of course, the key to us reopening. So what is the plan for the ramp up testing? I mean, for example, I'll just take some big businesses, Amazon, Switch, Tesla, different county, but distribution warehouses and manufacturing. What the fire department, are we going to have enough tests to do all of those folks, and when would that begin?
So as I mentioned, we had received a number of the tests from a commercial lab in Southern California, and we hope to be able to begin utilizing those very soon. We had the distribution of 2,000 out of a total of 3,000 tests that we had purchased through the Regional Incident Command. The information that I received yesterday from DEM was that there was going to be future capacity that's anticipated to be available through University Medical Center in Southern Nevada for testing of 10,000, running 10,000 tests a day by the end of June. And so hopefully that means that they not only have the supply of the tests to run, but also the test collection kits and the swabs that we need to collect the samples. If that's the case, then that would allow us to expand our testing even more if we have the ability then to ship stuff down south for that. The state lab is also working to increase their capacity for running tests. They currently think that they can hit about a maximum of about 500 tests per day. I was on a call with Dr. Pandori earlier today, and they have purchased a robot to help with automation that will help to speed their throughput. And they're also looking at some other test kits that they may use that they think will speed up the test to about a 2-hour process faster than the 3.5 to 4-hour process. So if they can have that in place with a new kits that used for testing, that would give us a capacity of about 1,000 tests per day that we could run here locally at the state lab.
And have you? I'll just have 2 more questions. I'm trying to speed it up so I don't take up too much time. Do do we, I mean, you don't have to answer now, but it would be really helpful for us going forward to understand how many people you think that we will need to test in a day or a week, given 250,000 or 450,000 people in our community, 250,000 in Reno. You know, of those people, what portion of those work in larger organizations, whether it's a casino or manufacturing or something else, an IGT. And so, you know, do some projections and calculations for us going forward. And again, not to answer now, but I do have one more follow-up question, and that's, you've been talking about who has the disease in terms of who actually presents with COVID-19. And I guess I'm wondering about the antibody tests. Do we have access to those? I think you mentioned the doctor that runs the lab. Is he going to be doing some analysis to know what brands of tests that work here for us, validate the test? And I had heard that maybe it was through a blood draw. Are we thinking about moving to more of a blood drop type test where it's really simple, kind of more like a pregnancy test? You can do it at home. So where are we just with this antibody testing, and where do we think we're going?
So with the antibody testing, there's a lot of uncertainty that still surrounds the antibody tests right now. The state lab has received an Abbott antibody test that they're validating this week, and we're actually collecting the serology samples at our drive-through post today to assist with the validation testing on that. So that is a blood draw occurring for that test. There are others that are more of a fingerprint test. I think that the uncertainty surrounds how reliable the test is and how specific it is, and the specificity of significant concern is whether it's telling us if there are antibodies that for sure those are antibodies, or very, very high probability they're antibodies for COVID-19, or whether they might be antibodies that were developed for another type of coronavirus that might have caused the common cold. So the good news is the state lab is working to validate a test and to get more information from the manufacturer on the specificity of the test. And the Abbott test is one that they're working through FDA for approval of the test, which is a good sign versus just distributing the test prior to having that full FDA approval. But we'll continue to look at what are the antibody tests that are being developed and which ones are reliable. And as you said, if there are ones that are more easily deployed in the community, as far as a fingerprint test, that would be a great benefit to us.
Well, you yield my time here. I'm sure other people have other questions, but I will have a follow-up question on testing. Thanks.
Okay. And I'll need to let you know I do have a time certain I got to drop off. We've got a press briefing at 11:30 that I'm supposed to join.
Councilmember Dewar, I'm going to go to the next members, and so it may not be possible to get back to you, and I'll try to just hold everyone to their 3 minutes on this end. I apologize for being a little lax, but Mr. Dick does have to get to another conference call. So I'm going to open it back up. I think.
Mr. Vice Mayor, did you want to call on someone else?
Yes, I'm waiting to see who has raised their hand. Thank you, though. Okay, I'm going to ask a question then, and I'll give my colleagues an opportunity to see if they have any additional questions. Mr. Dick, and thank you for being here. I do want to echo the comments that Councilmember Dewar made about thanking you for your work during this crisis. I think it has been certainly super important. I wanted to ask because given the state of both the national and the state response to the crisis, I wonder if there is a discussion among your folks and epidemiologists about how regions of the state might be treated differently for the purposes of the virus. Meaning, is the phasing that you're talking about and the different testing metrics that have to be put in place, is it accurate to say that those metrics first must be met here in Washoe County, and then we might enter into a phase 1 or a phase 2, followed by the phase 3? I mean, can you speak to the sort of locality of it?
So I have not had discussions with the state Department of Health and Human Services or the governor's office about a local approach. And so we just heard from the governor last night, his first briefing on how the state will be approaching the phasing. So I can't speak to whether we're going to have the flexibility for a local or a regional approach, but I certainly think that discussions of what we think makes sense for that are warranted. I would add to that that we have residents in Washoe County that travel to our surrounding counties, the Quad County area, for employment and family and other reasons. And we have residents from those counties that commute in to work in Washoe County or to recreate, et cetera. And so I think it is important that we look at this regionally, because if we're not succeeding along with those other 4 counties that we're closely connected to, then a failure in any of those areas could lead to a failure in Washoe County, if that makes sense to you.
Yeah, no, I think, Mr. Dick, for sure, we are a region, and we have some interconnectivity because of our transportation corridor and some of the business entities, especially with regard to those in the Tahoe Regional Industrial Center. And so your counsel is wise. Ultimately, the question that I think we get asked most is kind of the question on everyone's mind, which is, when are we going to move to a phase 1 scenario? And I think it's premature to say. I think from an epidemiology standpoint, you're providing us the technical data, and we will be looking to you and the science behind the decision-making. And so obviously the governor's order affects us on a statewide basis. I'm not suggesting that it does not. I just wonder if regions of the state will have to be looking at their data very directly and specifically. I don't know outside of Washoe County and Southern Nevada what real deep, thoughtful analysis is being done about their numbers, just because I don't know if they have the same resources we have. I think those are the questions I have for now, Mr. Dick. And I did want to go to Madam Mayor because I know she has a number of thoughts. And so, but my screen went down, so I can't see the hand raised. But Madam Mayor, are you prepared?
Can you hear me?
Yes, we've got you. Madam Mayor, you're on.
Thanks. Thank you so much, Kevin. I really appreciate you being here. I think this is really helpful. I know we have those other briefings, but it's just, I know that everyone's got a lot of questions, so I really appreciate it. A couple of things, and maybe this is for Sam. I think, Sam, if you're still on, I'm curious to know if you have, where you're obtaining the PPE, and I know I've been sending Mr. Layton contacts and you know, suppliers that reach out to me. But I'm just curious if you are getting any other leads, you know, throughout the state on PPE and also ventilators.
I don't think Sam is still on the call, but I'm wondering if perhaps Bob Layton might be able to respond.
Is he on, Bob?
Mayor, this is Bob Layton. I am on.
Hi. Hi.
So I caught the end of that, but as far as how we're procuring different resources, we'll get a large list of people who are willing to give different types of resources in PPE, and those are sent up to the state. The state actually vets all of them because we get a lot of different offers from a lot of different locations. And after the state vets them, we send in orders through the EOC and through the incident management team throughout the region to fill those orders.
Oh, okay, good. I know I've sent you several. I just wanted to make sure, like, how those get distributed. And then, Mr. Dick, can you kind of explain, because I think there are people out there that are saying, hey, well, we've flattened the curve, now we've got to, get going. And can you explain why that is so important? Because I think people believe that now we're on the downslope, but are probably not aware that those numbers could climb quite rapidly. Can you explain exactly?
I'd be happy to. Thanks for that question. As I mentioned, being at the peak means that we have, we're in that period where we either are going to see the highest number of cases on a daily basis that are occurring, or we've just passed that peak where we are seeing the highest number of cases. If we reopen while we're still in that range, then we are at extreme risk of just surging from there with the spread of disease from those cases occurring in the community as we reduce our mitigation measures of the social distancing. So it's very important that to benefit from all the sacrifice that has been made so far, that we continue with the social distancing so that we can come down to very, very low numbers of cases occurring on a daily basis before we reduce our protective measures. If we don't do that, then what we'll have done will have been for naught, and we'll see our cases skyrocket and potentially have a huge surge and exceed our healthcare capacity, et cetera, be back at the place that we were as we started out. So we need to, we've come to a place where we believe we've stopped the daily increases in the number of new cases being identified, but we need to continue with this so we have very, very few cases identified in the community as we then would begin to reopen businesses.
Thank you. I really appreciate that. And from what I looked at, the cases were going up. Am I right?
The total cases continue to go up. But what we want is for the number of new cases that we identify on a daily basis, for that number to go down. So even yesterday we had 22 new cases identified.
Okay.
So we're going to have 22 more cases that were added to that 684 tally. What we want to get to is we have days where we have no new cases identified, or we have just one case identified. We need to reduce the number of new cases that we're getting on a daily basis.
So I think that's sort of the confusion. What I'm hearing, people are saying, well, wait, we've flattened the curve, and they think that we're, on the downside. But I think people don't realize is that you're still seeing those cases go up. And so I think that messaging is really, really critical. And I also think now more than ever, because the weather is going to get really nice and people are, getting anxious and things like that. So I think it's really critical for that type of messaging that people understand that those cases are still on the rise. And it gets a little bit more tricky, like I said, because people are, anxious and want to be outside. And we want them to be outside. It's just we don't want them congregating in groups. So I appreciate that.
Absolutely.
One more thing, just really quickly, Kevin, and I know you got to run, but I think Councilwoman Dewar was speaking to this about the testing at the labs. And many of us have heard Dr. Birx talk about some of those machines that can process, mass amounts of tests. Are we looking at other laboratories to do some of this mass testing, and do we have the capability to do that?
So the hospitals are also utilizing LabCorp and Quest for running their tests. So we do have commercial labs that are contributing to the test capacity for our region. And the state lab is also looking at other testing equipment potentially in the future. The governor's task force is also working on the state's testing capacity. And so I met with gentleman Alex Dixon, who's leading that effort last week. And so believe that they're responsible for the work with the Arab Emirates on the increased testing capacity that University Medical Center is going to have. But we're not at the health district really taking the lead on working to develop the testing capacity. We're letting our state lab and the governor's task force work on that. And we're focusing on the capability of doing the test specimen collection and all the work that goes around that and the contact tracing. But that's an excellent question, Mayor Sheeby.
Okay, thank you. I appreciate that. And one last sort of question or something to think about that I think we're going to have to address. I think this is really important. We're seeing a lot of antibody tests come out. The last I was reading was like 70 of them are coming out, and many of them are not FDA approved. I think there's only 3 or 4 that might be FDA approved, if that. And so I'm hearing a lot of people say, well, I'm going to go get this antibody test, and especially the ones out of China I'm hearing are only 60% accurate. And so a lot of people are saying, I'm going to go get the antibody test. So, and I think that can be really dangerous if it's a false negative, right? And so it's something to be thinking about how we as policymakers and certainly through the health department, how we address that, because it does concern me a little bit that people will be out there saying, oh, I took the test and I have the antibodies, or I haven't, tested positive for COVID-19, things like that. Is that something that you guys are kind of looking at a little bit?
Well, Mayor Sheeby, it's Kevin Dick for the record. We certainly are watching what's going on with the antibody tests, and we're concerned that people not place confidence in them inappropriately. But I'm making a note right now to have our regional information center team work on materials and messaging on that. I think that's a good point. And I just also mentioning the regional information center and everybody else that's been involved with this. I just also wanted to comment there with some of the compliments that I appreciate on my performance. This is really an incredible effort by a huge number of people that are putting their heart and soul into this response and making this all happen. So I just wanted to recognize that this is not me. This is an incredible team of partners that we have in our region working together on this.
Oh, I really appreciate that, because I think that people lose sight of the fact that this is a really massive event and undertaking, and emotions can run really, really high, and it's easy for people to want to blame others during this time. And so I really appreciate you mentioning that. I'm grateful for your service. I'm grateful for Bobby and Sam. They have been tremendous, and it has been incredibly stressful for everyone. So thank you for recognizing them. I think that's really important, and everyone that's doing the great work at the JIC too. The JIC has been highly helpful, and I think since that's been in place, it's really had a much bigger effect on communication. So thank you so much. I really appreciate it, and I appreciate your time.
Thank you, Mayor.
Councilmember Jordan.
Thank you very much. And Kevin Dick, again, thank you for all your work. I know you've had many sleepless nights for sure on these issues, as we all have. I guess my question is this, and to Sam Hicks and Mr. Layton as well, as we transition back into the jurisdictional authority on some issues, I'm going back to the homeless issue, and as we at some point begin to remove the homeless population from the Reno Event Center, our understanding is that the advice from the health department and HUD and the CDC is to not disrupt the encampments. And I guess my question is, as we transition back into some prior form, it's my understanding that we also won't be able to have the capacity we had Record Street, that it will be cut maybe even in half, and that will leave a significant amount of our homeless population without shelter. So my question is this, is who, your guidance has been not to disrupt the encampments. Now we're starting to see them cluster. There's some public safety issues. How is this all going to work out from a region, or are those discussions going on, how as a region we're going to address this phase one as it relates to our homeless population?
This is Kevin Dick. I'll respond to that briefly. Julia Ratty has been leading the homeless services branch, and I think has done an excellent job in working with facilitating the discussions and actions of a number of organizations and jurisdictions around the homeless. And I'm actually, I was on a call yesterday. I'm on another call later today with discussing the path forward with the homeless population. You're correct that if we are instituting social distancing requirements, as we'll need to, until we have a vaccine available down the road, that will reduce the capacity at the Record Street shelter available for housing that population as they transition out of the Reno Event Center. I don't have a solution, or there hasn't been one that's been identified at this time, but we're in discussions about how to approach that. And I think it's important to recognize that while we have this pandemic going on and the emergency that brings, it's complicated by the inequities that we have in our community and that we have had for some time with struggling with how we deal with the homeless population, but also having other areas of our community that are disadvantaged and are impacted more by the social distancing and the stay-at-home directives than others, and that are also, because of underlying health conditions that we see in our disadvantaged community, disproportionately impacted by this disease. So it's a complicated situation to begin with. It's just become much more complex with the COVID-19 pandemic happening on top of that.
Thank you.
Councilmember Dewar.
Sorry.
I think Councilmember Dewar, you were next up, and then I'll come to Councilmember Breckus.
Okay.
We might not just have too much time.
Okay. I'll make this quick. I just wanted to know, Kevin, coming back to the testing. So let's take the nursing home that's a few blocks from me, which is one of the worst in the state for people passing and cases, but mostly people dying. The question is let's say they've gone in and tested and there's 46. Don't we need to keep retesting like every 7 days or some period to show whether more people are getting it? I mean, it's not a static number. So I guess what I'm wondering, both for nursing homes or anything you want to reopen, do we have to have an ongoing testing program? And what kind of frequency?
So we will need to have ongoing testing programs. The test for COVID-19 only tells us whether you had the virus and had sufficient viral load that it shows up when we run the PCR test on the sample that we collect from you. So it's a point in time test of whether that virus was present in your body when we collected the sample. It doesn't mean that you will not have the virus the next day or the day after that. And that's where the antibody test can become important for us if we do identify reliable antibody tests.
So that I think was my point, is that it changes over time. So you may have tested everyone in a certain setting, maybe half the people tested positive, but if you go back a week later, it may be that more people test positive. And I think what you want to do, according to the protocols I understand, is to isolate those people to keep them from passing it to someone else. So I'm just wondering, especially for these congregated facilities where, when or where would the testing be occurring on a routine basis? Are we up to that point yet?
So we're not up to that point. That's where we want to use some of our commercial lab test kits to be able to focus on some different facilities. But it's also complicated because the state has the authority over those facilities that they license, and so they're the ones that are directly responsible for that investigation. It's not under Washoe County's jurisdiction for the operation of those facilities. So I'm afraid I've got
So this is something.
I've got that press briefing that I'm going to have to drop off, or I've got Adam Bainberry pinging me to get on that. So I apologize. I do appreciate the opportunity to brief you, and I'd be happy to take any follow-up questions offline if anybody wants to follow up with me.
Thank you, Mr. Dick. We understand you've got to go. We appreciate your time today,
Okay.
and we'll look for additional time in the future.
Thank you very much. Appreciate the opportunity to brief you.
And I apologize to my colleagues. I know that Councilmember Delgado had his hand raised, and Councilmember Breckus also desired to speak. We just ran out of time, and I'm very sorry for that. I'll transition back to Madam Clerk.
Mr. Vice Mayor, with that, if no one has any closing comments, then we will get back in order of our agenda. With that, we
So
are.
could we just, wait, this is Councilmember Breckus. If we could just continue a little bit, I guess my comments aren't really necessary for him. It's just the overall conversation. And that is that there was a signing of a jurisdictional cost-sharing agreement early on, and I'm wondering if that was specific to standing up the incident. And as we move from dissipating from the incident and this longer process of testing and who's doing the testing, who's getting the testing, the longer need to quarantine people and stand up those housings, is there going to be another cost-sharing agreement? Because, and as more funds become available from different sources, federal stimulus or the state, I'm just thinking that it's going to need to be time to look at that cost-sharing agreement, because I'm not so sure that Reno is going to have the resources or should have the responsibility to pay for a service out of our funds that is a county service. And so I'm maybe going to be asking for some follow-up from our finance branch on this.
Councilmember Breckus, you of course are making a good point. I think this is something where the cost sharing that we entered into when we stood up the joint, emergency operations center, I think speaks to one particular thing, and whether or not that will be continued either in spirit or practice as we move forward, I think is unlikely. And so we do need to be keeping track of that. I'll turn to Madam Manager and see if there is any additional information you can provide to the council at this moment. But I think you understand the concern. We'll have limited resources. There are certainly things that we have oft said are the responsibility of the county. At times, our city seems to stand in the gap, even when it's not necessarily our, quote unquote, identified job, but it's our desire as a policymaking body to support the community in various ways. I think with regard specifically to our homeless population, for example, we've oftentimes stood in the gap in that way. And I think we are partners with our other regional entities, but we also have to be mindful of the economics of it. So, Madam Manager, I'll transition to you.
Thank you, Mr. Vice Mayor. For the record, Saber Smith, newbie. I think you covered a good portion of it in that the cost sharing agreement that we have in place is for this COVID crisis, and as it continues, I would imagine that it would still fall underneath that cost sharing agreement. That said, individual costs that are coming through can be classified as City of Reno costs or Sparks costs or Washoe costs or regional costs. So therein lies perhaps the good point that you had, Councilmember Breckus, about what classifies as a regional cost and what does not. So that's certainly something that I've been having conversations with with our emergency manager, Bob Layton, about, and with the other managers about. I don't know if Mr. Layton is on the phone, if he has anything, or if he's on this meeting, if he has anything to add, but that's all I have to add.
Manager Newby, this is Bob Layton for the record. Basically exactly what you said. The costs that are associated with individual agencies or jurisdictions, they will bear those costs individually through their FEMA reimbursement request and whatever else they're trying to do as far as managing their own jurisdictions. The regional costs that are associated with the emergency is what's going to be cost shared at the end. During the cost share, the agencies will all get together and they're going to line by line look at to see what the costs were, how they were allocated, what they were for, and make decisions on the cost share itself.
This is Councilmember Breckus again. Let me just, there was a spreadsheet that came out with all the costs. And just for example, the big cost, one of the big costs was this REMSA phone calling, service they're providing, which from Mr. Dick seemed to imply it's going to continue on past the term of that contract. My question is Reno paying 35% of that? Because that should be, in my view, a Washoe County service to all citizens of Washoe County. And so I'm really looking at, if you took that spreadsheet, it could show us past what is the cost sharing on those services we've already encumbered. Does that cost sharing sunset at some point? And also, as the new funds come forward from the state or the feds, who are they going to go to? And all I have to say to anyone is, who has a history, is fire divorce true-ups. Those went on forever. And I just feel that we need to be very clear with the costs as we move forward. Thank you.
Okay, Councilmember Breckus, thank you for your comments. I'm going to look to my colleagues. If anyone has their hand raised, I can see it now. We've figured out that in the chambers. If not, I'm going to move on from this agenda item.
Mr. Vice Mayor, with that, moving back to item C2. This is a public hearing, a bill introduction for WCSD Stead Boulevard zone change.
Okay, thank you. Let the record reflect that the City Council is opening the public hearing on item C2, case number LDC 20-00040. Madam Clerk, was proper notice given and any correspondence received?
Mr. Vice Mayor, proper notice was given and no correspondence was received on this item.
Okay, and do any council members need to make disclosures at this time? Hearing none, I'm going to move to the staff presentations.
Mr. Vice Mayor, staff presentation will be done by Angela Foos. Angela, we will be turning over control of the PowerPoint to you at this time.
And let me also ask, Madam Clerk, do we have an applicant who is present?
We have an applicant who is present via Zoom. They have submitted a presentation in which they will be available to give and answer questions directly after Ms. Foos' presentation.
Okay, like the first presentation, we'll focus first then on Ms. Foos' presentation and then come to the council for questions. Ms. Foos, the floor is yours.
Good morning. Again, for the record, Angela Foos, Acting Community Development Director. This is a request for a zone change. This is a 34-acre parcel located on the east side of Stead Boulevard and north of US 395. This is in the Stead area. The zone change, there we go. The zone change is a request from the mixed-use North Virginia Todd to public facility. This site is currently housing 2 schools, Stead Elementary School and O'Brien Middle School. And, it's existing as a school and planned to be a school for the long-term future. Based on the master plan, which is that public, quasi-public designation, the correct zoning should be a public facility. So the applicant, which is the school district, has submitted an application. Staff is in support of this, and again, it does bring the parcel into conformance with that existing master plan. They are going from a mixed-use zoning to a public facility zoning, which is in line with what the use plan to be. The school district has done a fairly robust outreach to the neighborhood, talking about future plans for this parcel. And so this is in line with those future plans. And in the future, development will require changes to the school, expansions of any schools or revisions to the school will still require a site plan review process. So this is just the first step in that process. The applicant is also available and has a presentation.
At this time, the applicant's representative, Andy Derling, is available via Zoom. We will be pulling up his presentation and transitioning control of that presentation over to him to control the slides.
Mr. Derling, welcome.
Thank you very much, Mr. Vice Mayor and Council. For the record, Andy Derling with Wood Rogers representing the school district on this. I do have a presentation. It is repetitive with Mrs. Luce's presentation. So if it's the council's desire, I can give it. If not, just the high points of it effectively are, this with Reimagine Reno having been adopted last year, this zone change is reflective of the changes that went on to the land use on this parcel, brings it into better conformance with having the zoning, more closely conform to the master plan. So I don't need to give the full presentation. As I said, it's kind of to staff and would be happy to answer any questions.
Mr. Derling, thank you for your comments. I will let you know that the technology seems to be going a little bit in and out from our end, and I don't know if that's your Wi-Fi connection. And so rather than having you make the entire presentation, I'm going to come back to the body and ask if the council has any questions for either the staff or applicant, and maybe we'll get to it from that direction. Okay, Madam Clerk, I'm going to come back to you. I don't believe there's public comment on this item, which I've asked at the beginning, but I will formally open public comment and also formally close public comment at this time. Okay, I'm going to ask for a motion. Councilmember Weber, are you, I see you're there.
Mr. Vice Mayor, I apologize. Prior to doing that, can we have the city attorney read the bill introduction at this time?
Yeah, I keep forgetting that that's where we are. Okay, let's go to city attorney, please.
Thank you, Madam Clerk and Mr. Vice Mayor. This is ordinance introduction, bill number 7138, case number LDC 20-00040, Washoe County School District Stead Boulevard zone change, ordinance to amend Title 18, Chapter 18.08 of the Reno Municipal Code entitled Zoning, rezoning a plus or minus 34.1 acre site located on the east side of Stead Boulevard, plus or minus 100 feet south of its intersection with Silver Lake Road from mixed use North Virginia Street Transit Corridor Overlay District to public facility together with other matters which pertain to or are necessarily connected therewith. Ward 4.
Okay, now I'm going to come back to general discussion. Councilmember Dewar, I see you've raised your hand. Thank you so much.
Yeah, thank you. I just wanted to clarify. So the only thing happening here is changing the site where the school is to public facility. Are other parcels also becoming public facility?
It's just one parcel, 34 acres, and that one parcel has two schools. So the one 34-acre parcel is being changed from mixed use to public facility. No other parcel.
So would you basically call this cleanup?
Okay, yes.
Okay. Most people don't go to the effort or pay consultants to do it. So that's why I was just a little bit confused. It seemed pretty straightforward.
Thank you,
Can I
Council.
ask?
Yes, Councilmember Breckus, you're on.
So, is there any development proposed for this site? Does the school district plan on doing any expansion to these schools? Yes. What is that project?
For the record, Amy Durling, if I can answer that. I know Adam Searcy is also on the Zoom as well from the school district. Yes, there are redevelopment plans for O'Brien Middle School that have been, as Angela had said earlier, that the school district's been working with the public on. So this is kind of part and parcel to setting up for that future redevelopment. Adam, I don't know if you have anything else to add.
And for the education of us who are watching our zoning code work, does this zoning change then put this project that's proposed through a different procedure? Like, for example, not a special use permit, but a site plan review?
This is Angela again for the record. The bigger issue is the standards of the mixed-use zoning. Those are tough to comply with when you have an existing school site that will remain in place, right? O'Brien School is there now, and that will remain in place while they build O'Brien School to the east. Once the new school is built, then the old school will go away. So at the end of the day, we're trying to come up with a path forward for these guys to have a set of standards that make sense. The mixed-use standards don't make sense for really any school, right? The public facility zoning standards make sense for all schools. And this does not circumvent them going through a public hearing process. They will still be required to go through a site plan review process with the expansion of the school under that public facility zoning. While that is an administrative review process, it does get noticed, and then there is an appeal process as well for the site plan review.
Okay, I know there's a state law overriding it. I just think that this is maybe helpful from what I understood Ms. Stewart's questions to be. And so I think that for all of us who are trying to understand how our zoning code works, how we want to improve it, what the issues at hand are, we kind of need someone that background explained. And I will say I don't represent this area, but you know, the use of our street funds are regional, our school districts are regional, and I've just always heard so much concern about this site as a school safety one, and am wondering what the level of review would be, and if it would be reduced or you know, input not going on as much, because it's a site that I've always heard so much concern about publicly. Thank you.
Councilmember Breckus, thank you for your comments.
Thank you, Mr. Vice Mayor.
Yes, Councilmember Weber, this is your ward. Go ahead.
Yes, thank you very much. I absolutely support this, and I'm ready to make a motion. I think they've done a lot of, Washoe County School District has already done a lot of public comment, working with the community, and I understand what Councilmember Breckus was talking about this site. It has been an issue for many years, but I am very supportive, and I want to make the motion, and so I will. I move to uphold the recommendation of the Planning Commission and move forward with the process. Thank you.
Councilmember Weber, thank you for the motion. I'm going to be the second and just add my comments to it. I thank Mr. Searcy and the school district for the work that has gone into this. Mr. Durling, thank you for your presentation and participation. This is a really exciting opportunity for this community in the North Valleys. That school site, I think, will have some incredible future. And I thank you, Mr. Searcy, for that, and to the school district, and for moving forward on a number of these projects when, you know, money is easier, I suppose, to get bonding. Materials are cheaper, and so hopefully we'll see something coming out of the dirt there soon. Okay, I have a motion by Councilmember Weber, a second by me. I'm going to call for the question. All those in favor, please signify by saying aye.
Aye. Aye.
Aye.
Aye.
Any opposed? No. Motion carries unanimously.
Mr. Vice Mayor, our next item is C3. This is a request for an abandonment for Hamilton Industrial Campus abandonment.
Okay, I want to let the record reflect that City Council is now opening the public hearing on item C3, case number ABN 20-0005. Madam Clerk, was proper notice given? Any correspondence received?
Mr. Vice Mayor, proper notice was given and no correspondence was received on this item.
Okay, do any council members need to make any disclosures at this time? Okay, so hearing none, I'm going to also ask if, is this one that has to be read?
This one does not need to be read by
Okay.
the city attorney, so at this time, we will turn over the staff presentation will be presented by Angela Foos. Again, at this time, her PowerPoint will come up and she will take control of that. Additionally, it should be noted that we do have the applicant on the phone. The representative is Ken Crater. He is on Zoom and also has a presentation for council, and we'll give that after Angela's finished hers.
Okay, Ms. Foos, welcome.
Good afternoon again, Angela Foos, and Acting Community Development Director. This is a request for abandonment for a portion of Reactor Way, a little under 38,000 square feet. And this one has a lot of moving parts, so I'm going to try and walk you through this from a visual perspective as much as I can. This site is located east of the airport and west of Edison Way, so it's in an area that is currently an industrial part of our town. That portion there in yellow, the 33,924 square feet, is the bulk of the abandonment request. And the abandonment is being requested because Hamilton Industries, which owns the buildings in this area, is planning to do an expansion. And with that expansion, they were requesting to realign Reactor Way. So there's two things I want you to look at as part of this. One is that main abandonment portion, which is where the new building is proposed to go. And second is that smaller kind of triangular portion on the left, that's the 4,000 square foot abandonment. That's a small piece of reactor that is requesting to be abandoned. And then on the that 4,700 square foot dedication is an area that, through a separate process, but just so you have the full picture, is proposed to be dedicated to the city. So that's in a private parcel. One thing that's unique about this general area is that we have the university drain that bisects Reactor Way. So right now we don't have a through drive from Reactor Way when you go from Energy Way to that north down to Rock Boulevard to the south. So if you can see my mouse, this alignment that I'm calling out right here does not currently go through. It stops, the road stops at Reactor Way. So as part of this abandonment, ultimately Reactor Way will be a through road, and there'll be a road that goes over the university drain. The new alignment, so you can see ultimately what this will look like, is this green dotted line. So if you're coming in from Rock Boulevard, you will then have full access across that university drain. And instead, where you're used to cross Reactor Way here to get to Energy Way, we'll have a cul-de-sac here, and then this piece here, and I apologize if nobody can see that, that portion will be a new access easement, and that will be an access easement for fire, for pedestrians, for utilities, and so that will all be put into place as part of this abandonment. We have conditions that require that happens, and so basically, again, a portion of Reactor Way is going away, but a new portion is being provided to still provide that access to get from Energy Way to the north down to Rock Boulevard to the south. And this is an exhibit that was included with the application. And that basically kind of compiles everything I just talked about because it's a lot of information on one exhibit. I wanted to walk you through that. So this is the end result of what the abandonment request will look like. From a zoning perspective, again, it's surrounded by industrial commercial zoning. We do have one PF zoning, that is the Waldorf School. As part of this, they will be getting additional access because, again, Reactor Way stops pretty much at their parcel because University Drain bisects reactors, so this will give them full access. They will also be getting additional landscaping as parking along reactor as part of this abandonment. And that concludes my application. I know the applicant also has an application and he can provide more detail.
Okay, and now at this time, we will transition over to the applicant's presentation. We're pulling up the other presentation at this time.
And good afternoon, this is Ken Crater. Hopefully everyone can hear me.
We can hear you, Ken. And you will be receiving control of the PowerPoint momentarily. You should have it now and you're able to access your slides at this time. You may begin your presentation.
Okay, perfect. So Angela did a good job of explaining this. I'll try and add additional information. But again, I think the key is the fact that when Reactor Way was platted back in the 1970s, it was originally planned to connect from Rock Boulevard to Energy Way. But as these parcels developed, I believe that folks just didn't want to bear the cost of extending the road across the University Drain. And so right now you basically have two local street segments that do not connect. So that will be changed with this project. And you may have heard about the Hamilton Company. As of late, they've been in the news because they manufacture medical devices. I've been working with them for several years as they continue to expand their company and their industrial park. They're really a fantastic company with good people, and they're a pleasure to work with. We had a lot of community outreach on this project. We worked very closely with High Sierra Industries. High Sierra Industries is a local nonprofit that provides training to folks with disabilities. If you've never had a chance to go and tour their facility, I urge you when we're allowed to have groups of more than 10 to go see this great facility. They really provide a great service to the community. And then we also work with the school that's owned by McKenzie Properties as well as McKenzie Properties. And in fact, both McKenzie Properties and High Sierra Industries signed the petition for abandonment. One of the main issues that we found in this area is there's a lack of parking. And so with the abandonment application, we look for ways to increase the amount of parking in this area. And then also utilities, making sure that we maintain utility connectivity as well as maintenance access to the area for city crews as well as private utilities. I want to point out that Hamilton does own a lot of buildings in this area. You can see in this aerial exhibit where it shows the Hamilton campus existing. That was sort of their original core business. If you can see to the south where it says University Drain, they also own the two large buildings underneath the word drain and also the two parallel buildings underneath the word university. And then if you go to the intersection of Reactor Way and Energy Way, in particular parcels 012-36201 and 012-36202, they recently purchased those parcels, and that's where they want to look at a building expansion. If you look at their four buildings on their original campus, you can see they're all connected with essentially what they call a tunnel system, and this allows them to move people and goods from one building to the next during the manufacturing process and keep everything dry and safe in any sort of inclement weather. And really the purpose behind the abandonment application is to allow them to link the new building with the building that's currently right up against Reactor with an additional tunnel. So hence the need. But you can see in this aerial photo where the University Drain flows between the two sections of Reactor Way that keeps it from being connected. And again, you can see the areas of abandonment as well as an area that Hamilton will offer for dedication to allow that roadway to be connected. And you can also see that we have the parking lots on here for High Sierra Industries, McKenzie Properties, as well as Hamilton. One of the things that we've been working on with Hamilton is to revise their parking lot. Right now they have a very inefficient layout with angled parking, and we recently submitted plans to allow for 90-degree parking, which will add a significant additional amount of parking in that area. And the other thing, you can see some diagonal parking on the east side of Reactor Way, and right now people park diagonally just because of the lack of parking. And so in working with the neighbors, we agreed to basically narrow Reactor Way as you're coming across the bridge to the north, It's a 70-foot roadway right now. It's a very wide road for even an industrial street, for a local street. And by narrowing that road to 50 feet, we can provide some protected diagonal parking spaces that we will actually stripe and just add additional parking to that area. And we're also able to add roughly 14 spaces to the High Sierra Industries parking lot and 3 additional spaces to the school site, and still maintain the large mature tree that exists in the middle of the school site today. This is a little closer view of the parking. Again, you can see the diagonal parking along Reactor Way, as well as the expanded parking for the school and High Sierra Industries. It's also critical that we found that we need to provide better pedestrian access. Right now, the sidewalk is really disjointed in this area, and the school and High Sierra Industries both frequent an RTC bus stop on Energy Way, and so we will be building a sidewalk all the way from the school all the way up to Energy Way, so you have safe pedestrian access to the bus stop. And we'll be working with the Regional Transportation Commission to locate that bus stop closer to the new point of where it will come on to Energy Way. And then finally, you can see the new building roughly located on there, along with the tunnel to the existing building. And then the new roadway, which will be a public use and access easement that will basically run due west on the south side of the building, and then the turn to the north to Energy Way. We've planned that as a 30-foot width, which will be more than adequate for trucks, for fire engines, as well as the motoring public, and again, a 5-foot sidewalk that meets commercial standards to provide that pedestrian connectivity all the way from the school all the way up to Energy Way. This highlights the additional 14 spaces in gray for High Sierra Industries, and again, the 3 additional spaces for the school. Coupled with those diagonal spaces will really increase significantly the number of parking spaces in that area that's currently underparked. Again, we have a lot of community outreach. We have multiple meetings, both individual meetings and joint meetings with High Sierra Industries, McKenzie Properties, the school, as well as the head of the school, and that really sort of guided the design of this abandonment application and the additional parking, the pedestrian access, making sure that everybody can circulate through this area. So the application was filed after these meetings to make sure that we're able to address all the concerns. And again, we've addressed the utilities. We've worked with staff on this. One thing that will occur with this abandonment is the sewer line. We've agreed that we will provide a maintenance agreement to the city prior to the recordation of the order of abandonment. We will take over privately that section of sewer line that serves the school, High Sierra Industries, and Hamilton, and we will maintain that because it's going to actually need to run under that tunnel system to tie into Energy Way. Staff is good with this, and so I feel like we've really addressed all the issues with the community outreach, working with the staff. In fact, I want to thank Angela and everybody else at the city. It's been a lot of work, but I think this is a good request, a good project, and will allow Hamilton to continue to manufacture very important medical devices, especially in this time of the coronavirus. And that concludes my presentation, and I'm happy to answer any questions.
Thank you, Mr. Crater. I'm going to come to the body now and see if there are questions for the applicant or staff. Give me just 1 second to see our board. Okay, Councilmember Breckus, did you?
Yeah, I do have a question, and I am familiar, this is from Ward 3, but I am familiar with the High Sierra Industries building and the McKenzie property and their tenant. The question is the bridge, if you will, over the university drain, is that going to be a dedicated public facility, or is it going to be privately owned staff?
This is Angela. Well, at this point, the abandonment's the only thing in front of us. It's my understanding that they will be submitting plans for that bridge, and then that will be part of Reactor, which is a public road. So ideally, that would be dedicated to the city, but they haven't submitted plans yet. So when we get to that level, we'll confirm all that.
No, I think that should be a part of our order of abandonment. I don't want us to have to take a heavy load bridge onto our bridge inventory when we are having challenges maintaining and rebuilding our existing bridges. So it's maybe, kind of a small culvert but bridge, and I think it needs to be privately owned and maintained. That is a big one for me. I think that a lot of the work that's gone on in packaging this together with the neighbors has been good, but the council needs to look out for the city and our maintenance responsibilities, and this is an extraordinary burden to us of taking on a bridge. It's not just taking on some more road width, it's a bridge. And I think we need to find a way to have it privately owned and maintained.
Thank you, Councilmember Breckus.
And if I can address that quickly, it's actually not a bridge, it's going to be a box culvert.
Mr. Crater, hold on one second. Councilmember Breckus, you've made a good point. Thank you for that. Mr. Crater, you wish to respond?
Yes, it won't actually be a bridge. We're actually just putting in a very simple box culvert. So the roadway will basically rest on top of the box culvert. And I believe it makes sense for that section of reactor to be a public facility, as it does serve the McKenzie properties as well as the school. But if it's council's desire, I don't think that Hamilton would have any issue in maintaining that box culvert structure, maybe as a minimum.
Thank you, Mr. Crater. I'm going to come now to Councilmember Delgado. This is your ward.
Thank you, Vice Mayor. Appreciate it. I'm very familiar with the project. I know it's been in the works for quite some time, and have many conversations with High Sierra Industry with this project. It's been, I believe, a few years coming. I'm glad that it's come to before us now. I know there's been a lot of work involved with that. There is a piece to Councilwoman Breckus' point, though, with respect to ongoing maintenance with some of this, and I'd like to look at staff to see in terms of just opportunities where we could, if the opportunities are there, to have a private, maybe Hamilton or whoever else, take on the maintenance or the ongoing maintenance opportunities of anything that we don't, being conscious of the fact that we're in the midst of a economic hit, and anything that I see that we're going to have to take care of, I'd rather not. So, I mean, if there sounds like Mr. Crater is suggesting that there would be opportunities there, there may not be the conversation today with respect to the abandonment, but once those projects come before us, I'd love the opportunity to see where that can happen.
Councilmember Delgado, can I get a motion, please?
Move to accept. Move to accept.
Second, Dewar.
Okay, I have a motion by Councilmember Delgado, a second by Dewar. Discussion?
Yeah, I'll support, but if there's administrative decisions to be made in delegation, I think that the statement has been made, if it's not in the order of abandonment, that this will be a privately maintained box culvert. Thank you.
Yes, I appreciate the clarification, Councilmember Breckus. I think that was the intention by the motion maker and the statement made in the record. I'll call for the question. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? No. Motion carries unanimously. Council members, I've had a request to take a break, and so we're going to take a break for the next, I think, 15 minutes, give everyone a chance to stand up, shake their legs out, do what they've got to do, grab a bite to eat. We'll come back in 15 minutes. Okay, I'm going to call this meeting back to order.
All right, Mr. Vice Mayor, with that, we are moving on to item D1. This is a review of police facility impact fee.
Okay, I'm going to welcome staff to make a presentation. Madam Clerk, did we have public comment on this item?
Mr. Vice Mayor, we have no public comment on item D1.
Okay, let's check in with staff.
And at this time, I do not have a staff presentation. However, I will defer to City Manager.
Thank you, Madam Clerk. I believe that this is an item for Mr. Stockham to discuss. If he is on.
Sorry, friends,
We are
we're just
showing
getting...
Mr. Stockham is on. He is just currently muted, so he will need to unmute himself in
Mr.
order
Stockham.
to speak. There we go. He is unmuted now.
All right, thank you. Take it away.
Good afternoon, council members. I just got patched in. Are we started back up here?
Yes, the floor is yours. We're on item D1, and we understand that you'll be handling the staff presentation.
I will. For the record, Arlo Stockham, Acting Assistant City Manager. Ashley, are you able to pull up the presentation for this one?
Arlo, I don't believe that we have a presentation for this item. However, we will check one more time.
Well, I can talk through my presentation.
Well, I'm not sure I'll be paying much attention because Councilmember Jardin has the winning background for our Zoom backgrounds for now, and I'm just enamored. But here we go. We've got the
We do have the
presentation, and here it
PowerPoint
comes up.
And Arlo, we have now transitioned control of the PowerPoint over to you, so you will be able to begin your presentation now.
Good afternoon. We're here to talk about a police impact fee system today. I have a fairly short presentation and then open it up to questions and discussion. We've been at this for about 5 months. On November 6th, the City Council provided direction to analyze impact fee systems for both police and fire services. The police impact fee system is really pretty straightforward, and we're here before you today with a package ready for consideration and possible approval. Fire impact fees are more complex with multiple facilities and will require more time moving forward. Procedurally, staff developed a draft impact fee system back at the end of 2019, and then conducted some pretty extensive outreach to get feedback on that package in January and February. Some revisions were made through that process I'll touch on in a minute. And then the Reno City Planning Commission, also acting as our CIP advisory committee, unanimously recommended approval on March 4th, just before the COVID pandemic hit. Why do this now? Public Safety Center, the existing police station is outdated and not really feasible to improve. Also, police headquarters have become deconsolidated and are not in a central location. So decisions have been made to pursue a new police station that would serve the entirety of Reno, exempting a couple areas we're not responsible for. The overall cost is estimated to be about $33 million, and the impact fee system would fund the portion of it that's attributable to new growth, which is approximately 9% of the total police station cost, would be funded through this impact fee system. Total funding plans at this point, general fund revenue, sale of city property, the generous offer from the Pennington Foundation, and other funding sources that are going to need to be determined. The impact fee system before you today would raise 9% of the total cost, about $2.9 million over a 10-year period. In terms of how we allocate that cost, there's a pretty established system for impact fees set up in state law. It starts with the service area where the facility is going to serve. In this case, we have one police station planned to serve the entire area that the city is responsible for. However, that includes the lands owned by the Nevada System of Higher Education, the Airport Authority, and tribal lands. So those areas are not subject to the impact fee system. We don't provide primary response in those areas. The next step are land use assumptions. What is our planned growth moving forward? For that, we've utilized the regional planning agencies, projections, and methodology. Then it moves to the facility cost. How do you allocate that? And that's where we had some discussions. There's really two ways to fairly allocate costs. The package, you can do it based on people, with the assumption that people demand police service, or you could do it based on calls for service. We did an analysis of both and came to a recommendation of using people, residents plus employees. However, some adjustments have been made to that through the process. And then finally, the part I don't see on my screen is the impact fee calculations themselves. So we've proposed a package that uses the same land use categories as the RTC uses for the regional road impact fee system. That eases administration a lot, where we don't have to have applicants calculate how much square footage to different land use types. It's the same calculation as is used already for the regional road impact fee system. What that means in terms of dollars, for residential uses, it's per unit. So it's $125 per single family house, $100 per multifamily unit. And then there are variable rates for commercial, office, and industrial uses based largely on the number of people, residents and employees in each facility, but also an adjustment factor that we put in to also reflect calls for service. I'll touch on that in a little bit. So here are some of the sample fees. Non-residential ranges from a low of $3 per 1,000 square feet up to the highest are the office uses and medical offices at $255 per 1,000 square feet. What that means for different types of projects, starting at the top, really a small project, one single family house, $125. If you're doing a restaurant, a fairly mid-sized to large restaurant, 4,000 square feet, that would be $740. 20-unit apartment complex gets you to $2,000. 10,000 square foot medical office, $2,550. And as you get into really the larger projects, a supermarket like a New Raley's or something like that would be about $13,000 and change. And on the really big side, a 1 million square foot new warehouse would be paying $29,000 under this system. So that kind of gives you a feel for the scale of these resulting fees. Generally modest as fees go, but obviously any fee is an additional cost. In terms of feedback, when we did our outreach, there's been kind of a longstanding mantra of growth should pay for itself, and this does that. Additionally, there is pretty strong support for using impact fees as a proportional method to fund necessary public infrastructure, as opposed to exactions, which tend to apply to larger projects that have complex approvals, but don't apply to many development projects. So overall support for doing a system like this, both in police and fire. There's obviously a general concern about raising fees of any sort. And where we got into some revisions is what methodology to use. When we ran the calculations based on employees and residents, What we found is the fees were relatively low for some of the uses with high visitation, restaurants, hotels, things like that. Whereas when we ran the numbers with calls for service, it really didn't match up very well at all. It's hard to tie calls for service to individual parcels. And we also need to keep in mind that a lot of the calls for service are while people are in transit, don't necessarily respond to individual buildings. So, and additional input that we should be as creative as we can with funding to try to minimize costs. So 2 revisions were made through that process. One was a termination date. That is so this wouldn't live on forever without affirmative action of a future city council. So without future action to continue the impact fee system, this would sunset in 10 years after funding for our currently planned police station. The second adjustment made was to do a blended methodology where we factored in calls for service to some, well, basically to 50% degree. So the fee calculations are based on a blending of people, employees plus residents, and calls for service. And that seemed to result in kind of the most proportional allocation of costs. And that's what's in front of you today. Next steps, there are 2 separate approvals required for this. In front of you today is to consider and potentially approve the land use assumptions. Should the council do that approval, we'll be back on May 13th with the first reading of the ordinance to establish the system, and then adoption would be on May 27th. Possible action, should you choose to move forward, is on the screen here, and I am happy to answer any questions you may have.
Thank you, Mr. Stockham. I'm going to come back to the body, but give us a second just to transition our technology over. Hold on one second, please. Okay, I don't see any hands raised at this time. Oh, Councilmember Breckus. Okay, we'll start with you. There's a hand raised button if you can just find it on the next go around. I'm not sure exactly where it is. I apologize, but you have the floor.
Okay, I did the reaction. There's a thumbs up and a clap, but maybe that's different.
If you click participants in the bottom of your screen,
Oh.
and then go to the bottom right-hand corner, yours will look different than ours as we're hosting, but you should see an option to raise your hand there.
But no problem. We're just trying to work out the technology. You have the floor. Thank you, Councilmember Breckus.
Yeah, so one question is, what is the recommendation of staff? Because it seemed to be not clear or ambiguous maybe on the staff report from what happened from the Planning Commission. So what is staff recommending at this time?
We recommend approval, and the Planning Commission also was a unanimous recommendation of approval.
Okay, now I've worked in jurisdictions with impact fees before, not intimately, and obviously we have them, but also in academic settings. And you touched on it in the methodologies. And is there a side technical memorandum that goes into, you know, some of these positions you raised about using visitation, using calls for service, all of that, and then also with references to other systems to really justify, you know, what we're proposing to do? I didn't see that in the materials.
We didn't do kind of a, you know, survey of other communities and different methodologies, so that documentation is not in front of you. The methodology is detailed in the CIP handbook that are attached to the staff reports. But there are different methods used. And the blend calls for service, I'm not aware of anyone just basing these strictly on calls for service. It's typically based on people. And that was our starting point. But again, because we have a lot of visitation in this community, the fees were really quite low for restaurants and hotels and entertainment venues compared to office complexes and facilities like that under the methodology. So the recommendation was to move forward with that blended factor.
Okay, here's point one, and you're following council direction, but I'm a little nervous that I read the CIP handbook when I went to Planning Commission, and then again, I'm not seeing a strong enough description on methodology, and I'll just bring up an example. The high hit seems to be on the warehouses, and the warehouses, to my understanding, don't generate a whole lot of calls for service. They're low employment centers and so on. So how are you going to defend that? How are we going to defend that when the first warehouse comes in? And believe me, I think those have big impacts, but on drainage issues, and that's why I've advocated for a drainage district. But on the calls for service, you know, when the first warehouse developer comes in and says, are we going to be able to defend this? And I'm a little nervous that I don't see as strong a defense as I've seen when I was following this more closely in terms of the technical memorandums that occur. So that's concern number one. I'm not opposed to the concept. Concern number two is also that if this is 9% of 9%, I think I heard, of the total project cost, and we've got bigger holes in other spots, you know, maybe we need to eat that part of the elephant first. And you know, I think there were talk about maybe asking the Pennington to hold off on the $5 million or I don't know, modify that agreement. And that was kind of a concern that I was starting to have is, you know, what's the other bigger plan? And on the last time we convened, I asked for a list of the properties that we thought we were going to sell, a list, and I still haven't seen that. So I'm, you know, I want to hear what my colleagues say, but I'm concerned. I do have concerns. I'm not opposed to a methodology of impact fees in general. I just want to make sure that it's one that, you know, one is part of a plausible project, and two is defensible. And on the impact fee methodologies, well, I'll just leave it at that. I probably have another comment I'll get to in a minute too.
If I could answer a couple of those questions, we can certainly bring you property lists. I'm sorry, I wasn't aware of that request of what we have for sale or potentially for sale. I'll go backwards on your questions. The 9%, state law is very limiting, that we cannot use impact fees to fund existing deficiencies. It really needs to be by law to be defensible, proportional with the new demands that are generated from that development. So that's what this methodology is, and that's where the 9% came from. Essentially, it's the expansion. Is what new development will be funding, rather than some addressing existing deficiencies. In terms of the methodology, there's a very important kind of nuance to this. I see Chief Deputy Mac Benson is on as well. He could probably elaborate. But a great deal of our calls for service are not to individual locations. They're while people are on the road or at a park or not at their home or place of work. So that's an important thing that's captured using the people methodology that isn't otherwise captured using response and calls for service. So we are quite comfortable that with the analysis prepared, this is fully defensible. And that's just an important thing to recognize. It's not just calls for service to individual buildings.
Well, if I could just follow up, I really do believe that the points that you just made could be very strongly used against the city in putting on these fees onto developments. One, not used to address deficiencies. We have one police station, we're rebuilding it, we're a 115-year-old city, you know, that has always had a police station. This project in and of itself is a deficiency to care for existing growth. That 9% is just the growth, and I guess you're modifying that. But to me, that is a vulnerability of itself. And then and also really cements the concept of, well, how are we going to fund the rest? But second is well, with police, you don't have a lot of calls for service to locations where you can tack it onto a building. To me, that's another issue why impact fees generally are not used for police stations, and why, if we get out there in court with someone who's going up against us on $30,000 to a warehouse, we could be very vulnerable, to my concern, because there's not a lot of examples of using them for impact fees, particularly for your one and only station. Let me ask you one technical question, then I'll yield the floor. Is, say I have a use that is a dry cleaners, and I want to convert it over to a bar, and do change of occupancy is going to require impact fees, or is it just going to be new construction ground up?
Change of occupancy, what is allowed, they pay the increment.
Okay, and that's fine. I get that. That's how we do our sewer calculations. It just adds a level of complexity of administration, which I'm sure you have thought about. But I do want to let everyone know that when I came on the council in 2012, the RTC director told me that their impact fee program that was generating maybe $500,000 a year was more costly to administer than the funds coming in. And so that's another cost benefit weighing that the council would need to think about too. If we're having all this work done, you know, with the resources, it's going to have, did you tack on administrative costs to your cost?
No, that's an important point. I'm glad you brought it up. We are not creating a new system to administer this. We already have the system with RIF. That's in large part why we're using the land use categories that we're using, so we don't have to have additional administrative costs. Essentially, it's just one additional calculation box in the SELA that spits out the bill. The applicants don't have to do any additional calculations, nor does staff. Chief, did you have anything you wanted to add on responses?
Arlo, I don't necessarily, I mean, I think you hit it right on the head in terms of, we look at warehouses, for example, the example that was provided, by the way, Mac Benzon, Deputy Chief, Reno Police Department, for the record. The example you gave in relation to warehouses and the associated traffic and all things that we've talked about in prior meetings in relation to, you know, special use permits or any of those things that we've done, those are all things that we took into account. I know that Sienna, when she put this together, and you, we talked a lot about calls for service. We talked a lot about how we generate this number, how we're going to generate this number. And so, you know, I'm comfortable with where we're at in terms of being able to defend it. Is it perfect? I don't know that there is a perfect system, but it's good. And I'm happy to answer any questions that anybody might have.
Thank you, Deputy Chief Benzon. I appreciate your comments. I ultimately am happy with the work that's been done by Mr. Stockham, and the presentation, I think, is informative. I think there are you know, concerns that Councilmember Breckus that has raised, but not so much that I'm willing to pause on the moving forward on it. In my own examination of the materials that you've presented, and in conversations that I have had with folks in the builder and developer community, it seems like there's general support for the concept and that there hasn't been significant pushback. I know that one of the suggestions was made had to do with something that is just not, I don't know if it's ready for prime time today, and that has to do with the way in which the Building Enterprise Fund perhaps has been overfunded, and whether or not there is any way for the offsets in terms of how the dollars are charged per door to be for a time or for even just in the next 18 months or so, sort of balanced through the Building Enterprise Fund. I'm not suggesting that that's where I lean. I'm just suggesting that that was the comment that was made to me about how, you know, we want to encourage development, and to the extent that we can do that, adding a fee during a difficult time may be difficult. I fundamentally believe that development, of course, and growth should pay for growth. I don't believe there's any backstop to, any other particular segment or person. So I just want to understand from your perspective, this is a necessary component of making certain that we can pay for the services we want as a city. And I think that that's been your position all along, Mr. Stockham.
It is. This is really the mechanism that we have in the state of Nevada to proportionally fund public facilities and services for new growth, necessary for new growth. So the alternative are exactions, which have been done in some cases. They're kind of negotiated case by case, but it doesn't spread the costs as evenly or proportionally as an impact fee system does.
Okay, I appreciate you. And I know that Councilmember Jordan, you had your hand raised. Councilmember Jordan, you have the floor.
Thank you very much. And Arlo, thank you for all your work on this. I know this has been a tremendous amount of work and creativity, and I know you involved the building community at great length through this process. And I just wanted to sincerely give my thanks to everybody's involvement on this. I think this is kind of the new model of how we're going to potentially move forward on some of these necessary safety things without a tax structure that allows us to do the things we need to do to serve our community. Our police department has been woefully physically underserved from that building for decades. So I think this is a move in the right direction. There might be some nuances that we need to massage as we move forward in collaboration with the building industry. But as you said, Arlo, the ability to do this on a global scale and spread it out so you're not just impacting one development or the last one in, those sorts of things, this really does. To me, it's a new model, and I just appreciate all of the work that you've put in, and I would make a motion to move forward.
Okay, thank you,
I'll
Councilmember Jordan.
second Dewar.
Great, I have a motion and a second. Any further discussion at
But
this? Any further discussion at this time? It looks like Councilmember Dewar's got her hand raised, so I'm going to go to you, and then Councilmember Breckus after that. Thank you. Councilmember Dewar, the floor is yours.
Yeah, I did both my computer hand raise and my physical hand raise. But anyway, I just had a basic question. First of all, I do really appreciate the effort that's gone into this. I've already talked to Arlo about this earlier. I think it is a balanced approach, and we really need the police station. One question I have, and I just thought we should get it on the record, is did we actually have a change? We've so often heard that we can have impact fees, right? Now we are doing one. So could you just explain that?
I don't have benefit in being in those prior discussions.
Oh, okay.
But NRS 278B
Right.
does clearly allow impact fees both for police and fire facilities. I think some of the discussion, as I understood, got into some of the nuances of fire facility fees and what can or can't be funded through those fee systems, for example, the equipment, and some challenges associated with the need to spend the money within 10 years of collecting it. Those challenges, are much less significant with the police station. We have a near-term plan to do it. It's one facility, and this will help fund the facility.
All right, thank you.
Okay, Councilmember Breckus.
Yeah, so when I got to Nevada in 1998 to work as a planner, I recall reading the impact fee statute about impact fees, and Nevada was a little bit of an outlier that they did allow impact fees for police and fire. The state that I came from, New Mexico, did not. And because it's not used often for these large facilities, as I mentioned previously, and I don't know if there's any precedent in other jurisdictions setting up these impact fees in Nevada, I would highly recommend that the council direct the staff to maybe run a small consultant contract, $10,000, $15,000 or so out of the Building Enterprise Fund, to have one of the firms that specializes in the stand-up of these programs, just to make sure we've got everything in good shape. It's a very boutique operation. There are only maybe 3 or 4 firms around the country that I recall when I worked on these many years ago that do this. But I think it would be very good and possibly save us time in the long run if we go down this path and then the first warehouse of 1 million feet comes in and starts balking, and some attorney gets sniffing that they're going to, represent them. So I think I think staff's done a good job. They followed our direction. We've got a big need and bigger financing needs, but I think it would be good to have another set of eyes on this because it is somewhat of an outlier. So I don't know, does the motion maker want to amend the motion to direct staff to do something along those lines to bring in just another set of eyes?
I would look to Arlo to see if that's necessary or not.
2 points. I don't believe it's permissible legally to fund that out of the Building Enterprise Fund. So that would be a general fund expenditure.
Really?
City of Sparks does have a very simplified impact fee system in place that, as I understand, covers police and fire. But it's kind of it's not as detailed as our system. It's kind of a pooled fee. We don't feel that's necessary for the costs that we're looking at here. We're not expecting any major opposition, and if there is, we have substantial data and information to support the system we're using. What I could offer is we could bring back before your next meeting some additional information of different systems that are in place in the state of Nevada. So you could consider that prior to adoption of the impact fee system, if that would be helpful.
Councilmember Breckus. I guess I don't.
Yeah, I think that would.
Go ahead, Councilmember Breckus. Councilmember Breckus, I have a question for you is all. So I guess I'm trying to understand, Councilmember Breckus, your concern is that we lack some information or like the business impact fee statement kind of thing to support this? Is that the concern that you have?
My understanding is that because this is in NRS 278, you don't have to do the business impact fee statement. It's more the assumptions of the fees themselves. There's a series of assumptions, and I know the CIP has those, but I think typically there's much more detailed technical memorandums that run with these. That's what I'm looking for and not seeing.
Okay, and so I understood it was like by analogy to the business impact fee statement. I would just look to perhaps legal staff to tell us that we have done the requisite homework and presentations and staff reports to be able to support the decision making. And so I'll look to City Attorney Carl Hall. I know you're on the line. It appears to me that everything is in order, and therefore I would be supportive of the motion maker's motion without the additional requirements that have been suggested. Carl Hall, I'll ask you to comment.
Hey, Mr. Vice Mayor, this is Carl Hall. I believe that the resolution and the impact statement, impact fee procedure is defensible. So I would recommend that you approve the resolution without the amendment.
Okay, I have a motion and a second. A motion by Councilmember Jordan, a second by Councilmember Dewar. In the absence of additional conversation or discussion from the body, I'll call for the question. All those in favor, please signify by saying aye.
Aye. Aye.
Aye. Any opposed, please signify by saying nay. Okay, motion carries unanimously.
Mr. Vice Mayor, with that, we are moving on to item D2. This is the FY 2021 fee schedule review and discussion. We have a presentation today. This will be started by Finance Director Debbie Lochner. And once we pull up her PowerPoint, she will be able to control the PowerPoint. At a time in which we transition to the parks discussion, we will then transition control of the slides over to Jamie Schroeder.
Okay, thank you. Madam Clerk, for the record, do we have any public comment on this item at this time while we're getting set up with the presentations?
Mr. Vice Mayor, we did receive public comment on item D2. We received comments from Donna Klontz, John Krompottek, Karen Vibe, Marcy Kopfer-Smith, Betty Mason, Teresa De Loretto, James Proctor, David Pritchett, Paco Lachoy, Sharon Zadra, Sarah Britt, Larry Weiss, Mac Rossi, Colin McCullen, Doris May Weber, and Carol Crane. These have all been submitted into the record of various positions and will be available online as well.
Thank you, Madam Clerk. And now, Ms. Lochner, I think we're transitioning to you, and you'll have control of the presentation in just a second.
All right, there we go. And let's just, so what we wanted to talk to you about today is the city fee schedule. This is the final direction that we're requesting from council before we bring it back for adoption in May. We'll just get right into it. I can get it to move forward. It's not.
Debbie, you should be able to control the PowerPoint at this time by using your arrow key or your mouse key.
Nope. Neither one's working. Is the city fee schedule. This is the. Can I share my screen instead, Ashley? Direction that we're requesting from council before we bring it back for adoption in May. Can I share my screen?
Yes.
Okay, let's do it that way.
All right.
All right. So, and it's still not, it's not working either. Oh, there we go. Okay. So what we wanted to bring forward is to talk about the fee schedule that we are getting ready to have a public hearing on, and just make sure we have the final council direction on that. So again, as we, this is not new information. We talked about the fees a couple meetings ago, but we wanted to get more information in order to bring back the fee schedule for final adoption. So as part of the budget adoption process, we look through all of our fees. Some of the fees get a consumer price index increase based on how the fees were put into place, and some do not. So not all of them get the CPI. Some have rates that are established under NRS, and then other fees we discuss with our commissions and boards and bring forward something for council based on their recommendations. So the CPI increases, this just shows you, you know, for the last 2 years it was 3.1%, and then for the coming year it's 2.8%. But as I said before, not all departments use the CPI, and not all departments are requesting an increase in fees. So we'll talk about park and recreation fees first, and then I guess I can quit sharing my screen. And you can see if Jamie can do it, because Jamie's next. We'll get real into the parks and rec fees, and then we'll come back and talk a little bit about building fees.
Okay, thank you, Debbie. At this time, we will transition over to the parks presentation, and Jamie Schroeder can take over control of that PowerPoint.
All right, bear with me real quick while I navigate my way through this PowerPoint. Okay, I think I have success. All right, so just as a reminder, why we are discussing this today is that the state had passed Assembly Bill 456, which mandates that minimum wage increase is set to go into effect on July 1st. And what that looks like is that minimum wage is going to increase 75 cents each year per year until we reach 2.7 or until we reach $12. And that is anticipated to take 5 years. So back in, I believe it was February, staff created a gradual price increase to generate the revenue offset for those additional expenses. After that council meeting, council had requested that staff revisit the fees to find a way to not raise the fees on the vulnerable populations. And so we're here today to present the 3 options that we have come up with. We feel like we have developed a program to isolate those who would be negatively affected by the fee increase, not raising the rates on them by doing adding a new feature to our scholarship program, while we still move forward with 3 options of raising the fees overall. So as a reminder, the minimum wage increase is anticipated to be $180,000 per year. If we do nothing, that will compound and it will create a deficit of $2.7 million over a total of 5 years. And that, just for everyone's information, that $2.7 million is equivalent to 16 firefighters or 17 police officers. You will see that some of these slides you've seen before, but I just feel it's important for the members of the public to hear the same discussion in case they weren't able to watch the meeting back in February. You know, as Director of Parks and Recreation, I have a fiscal responsibility to be accountable to, you know, our taxpayers. You know, and Parks and Recreation programs are often not offered by other agencies. We strive to price them at or below the market rate. And we are affordable because we operate on cost recovery goals, not necessarily 100% cost covering. And that's what allows us to serve more of the general population because it's funded through taxpayer subsidies versus that for-profit model. Again, we are recommending raising the fees for the actual Parks and Recreation programs offered by other agencies, so that the taxpayers aren't unduly burdened. Other than in parks, the fees for recreational programs are in direct relation to the user of that specific recreational service. Parks and Rec, when we establish the fees, what we look to do is determine the cost of the program. We look at the direct costs and the indirect costs. We look at what the cost recovery goal is based on which division that program is. And we look at, if we're starting a new program, can the new expenses for the new program be absorbed within the existing budget? Or do we see that, is there a program that is not necessarily successful, it's reaching its end of life for popularity, and can we replace that and reallocate those expenses from that previous program? So we have, we're continuing to recommend a graduated cost recovery plan, and that includes incremental fee increases to cover the cost of the minimum wage increase over the next 5 years. In doing so, we feel that we are planning ahead, and it allows customers to slowly adjust to see you know, what the expenses will be as they participate in our activities. Our fees will keep pace with the increased temporary wage increase. It would assist in alleviating annual funding requests in order for us to maintain our programs, and it provides stability for the Parks and Rec annual operations budget. All right. I apologize for the text sort of bleeding over. As a reminder, what our Rec and Park Commission has recommended, we made sure that we took this to the Senior Citizen Advisory Committee for their input, and then we took it to the Recreation and Parks Commission for their direction. I won't read this verbatim, but essentially their direction does recommend doing fee increases, taking a look at what the age of the senior is, and taking a look at our scholarship program and seeing if we can do something to modify that so that the most vulnerable population is still able to participate in recreational activities. Then, after we presented in February, this is a summary of what council direction was, and it also included trying to avoid increases in fees, raising the age of the senior, moving pickleball. Can we find grants, explore ballot questions, explore using other funds such as the Senior Citizen Advisory Committee donation funds, Reno Works, the Building Enterprise Fund, et cetera. Also to look at increasing fees in other areas such as the parking meters to subsidize. So now jumping into one of our most exciting things that I'm proud to present today to the council is taking a look at the situation and knowing we need to address it somehow in some way. Our staff has been very creative and thinking outside of the box. And so what we are presenting today is creation of a health and wellness division. And so what that does is it combines our recreation centers division and our seniors division. And doing so allows our staff to have more bandwidth because there will be now a larger group within one division. And so it would preserve the senior programs, assuming that we don't have to do any significant budget cuts or if the attendance starts to slide because the program reaches its end of life. It will, apologize one second. It also addresses, the big thing is that it addresses that the senior division has not met its cost recovery goal of 25% since 2015. But if you'll see in the chart, the recreation centers division has exceeded its cost recovery goal since 2015. So on the budgetary side, if we combine those two, it just creates a better mechanism for us to continue offering programs and meet those cost recovery goals. The health and wellness division would benefit all age groups, not necessarily specific to seniors, but it would still preserve the senior programs. So with the creation of the new health and wellness division, staff has come up with the idea of creating a health and wellness pass. This pass would be for scholarship recipients only because it's designed to take care of our most vulnerable population regardless of your age. It combines 3 passes, the senior activity pass, the recreation center pass, and our aquatics pass into one annual pass that provides scholarship recipients the ability to participate in 5 physically intensive activities at up to 7 of our recreation facilities, as well as 22 social interaction activities. This pass essentially addresses the fee increase for the most vulnerable citizens by giving them access to our department's most basic recreational services, and it would be an automatic inclusion into anybody who qualifies for our scholarship program, regardless of which percentage level it is. As a reminder, our scholarship program is available at 20%, 40%, or 60% off of our regular recreational fees. This health and wellness pass would not be charged towards the $500 allocation towards that fee assistance. It would be automatically included. So if you are a scholarship recipient, you would be able to get this pass and still have $500 to use towards some of the other more fee-based activities that we provide. The other large topic of discussion was the age definition of a senior. There seems to be quite a bit of consensus that 50 is too young. And so when we left the city council meeting back in February, the question was, what do we raise that age to? Some folks had mentioned 55, others had said 60. we were trying to figure out a way to tie it to some sort of a generally accepted mechanism. Finance had recommended tying the age of a senior to something recognized at the federal level, and so one of their management analysts took a look at Social Security. A lot of our discussion when we talk about vulnerable population comes to a commonality of seniors being on a fixed income, and so a lot of our discussion centered around what defines a fixed income. So we chose to say that the fixed income is generally associated with retirement and collecting Social Security benefits. And upon taking a look at the age ranges of when you can begin collecting Social Security benefits, the earliest age is 62. And so that is why we are recommending the new age of the senior becoming 62 instead of 50. So in the staff report, you will have seen a summary that talks about the 3 different options of a graduated cost recovery plan. All 3 options are similar, other than in the case of the first row you see on this slide. Option 1 is our original recommended fee increases. Option 2 is half of that amount, and then option 3 is raising the fees in areas except for drop-in fees. All 3 options include the new increased scholarship, the assistance program, the health and wellness pass. We did move pickleball into the open gym pricing structure, so it is no longer just a $1 drop-in for all. It has also been removed from the senior activity pass, so you would need to pay for a admission based on your best method if you're a customer. So you can just pay the general drop-in fee, which is now defined by different age categories. You could do a 10-punch pass, or you could do quarterly or annual passes. And then again, all 3 options say that the age of a senior is now increased to 62 years old. So as we took a look at calculating all the different fees that the Parks and Recreation Department has, we do anticipate that all 3 options will cover the cost of the minimum wage increase. As you look at this chart, it's very important to clarify that the funds generated in addition to the funds needed to cover the minimum wage increase, those funds would be credited towards the program area cost recovery rates. As a reminder, none of the Parks and Recreation programs are 100% cost recovering. And then these additional funds don't necessarily mean that all of our programs will be 100% cost recovering. It's also important to note that the estimated revenues that we calculated are based off of fiscal year 18-19 enrollments, registrations, or reservations. We are not sure what the future looks like. Our actual revenues may not be achieved in today's economic climate, just based on what people are experiencing personally in their financial situations due to the COVID-19. So if council chooses not to raise fees in order to cover the deficit caused by minimum wage increase, we also had to take a look at what we would have to do in order to make up that $180,000 gap. And so we wanted to provide what we would be able to do. And you'll notice as I go through each program area, some of the cuts aren't deep enough to cover the estimated wage increase gap per program area. And other programs, you'll see that the cuts are greater than what's needed to cover. So a lot of these programs have to help each other out as we try to figure out how we can still serve the community. So in aquatics, some of the reductions that you would see would be that we would have to eliminate open swim during the school year at Evelyn Mount Northeast Community Center Pool. We would have to look at reducing swim time, lap swim time at Northwest Pool by about 25% during the school year. During the summertime, we would need to eliminate 50% of the lessons that we do to the City of Reno youth camps and the Boys and Girls Club. At Idlewild Pool, we would eliminate 1 week of swim lessons. Evelyn Mount Pool, by year 3, we would have to reduce only 3 days a week of operation. And then by year 4 and 5, Northwest Pool would end up being closed for the summer, and then lap swim would be reduced 50% during the school year. When we move over to the athletics program area for reductions, We would end up having to cut one season of volleyball, cut the members of the field crew, temporary part-time employees at the Reno Sports Complex, and we would eliminate one season of basketball. Moving into our inclusion adaptive area, we would look to reduce the Reno Access Advisory Board donation funds by 20% of each year in order to cover the cost of what the minimum wage increase would be for the temporary part-time staff. For parks reductions, we would end up shortening the restroom season that go along with summer and picnic shelter rentals by 2 to 3 weeks in order to make up the deficit for that staff that we pay each season. And in recreation centers, we would end up reducing the number of hours at Neal Road Recreation Center and at McKinley Arts and Culture Center, and then ultimately by year 3, you would see that we would have to close McKinley in order to make up the deficit, except for that facility would be open for the existing tenants and rentals. In the area of seniors, in order to make up the deficit, what we would do is there is a catering contract for all the different senior events that we do, and we would look to cut that contract entirely. There would be other methods of providing some refreshments for the senior programs. It just wouldn't be to the level that they are accustomed to. And then lastly, in the world of youth, in order to cover the deficit, we would eliminate the Youth City Council donation funds. We would need to put enrollment caps on before and after school programs. We are required by the state to do a ratio of 2 staff members to 30 kids. And if we have to eliminate a portion of the temporary salaries to cover the cost of those staff, that would mean that we would need to put enrollment caps on at the different school sites so that we still are meeting the state standards. We would cut services and supplies, which would include eliminating field trips and buses for our summer camps and out of school break camps. By doing so, then we would be able to eliminate some temp salaries because bus drivers would no longer be needed. We would end up reducing our before and after school arts and crafts supplies. And then as we go further into years 3, 4, and 5, we would continue to put enrollment caps on before and after school programs by cutting those temporary salaries. And then eventually by year 5, we would have to eliminate the snack that we provide for the children at the before and after school programs. One slide that we did not put in the presentation that was part of the council direction was to take a look at if we were to sweep the Senior Citizen Advisory Committee donation funds and maybe use the funding for the Reno Works program because it has been so generously funded by members of our business community. Doing that, if we eliminated the donation funds, that would be roughly $43,000 a year, and Reno Works is $50,000 a year. So we would see the deficit be cut in half, but we would still be short about 50% each year. And again, if we don't raise fees to address it, we would see that we would still have a very large gap that we need to overcome. With that, I will turn it back over to council for questions.
Councilmember, or first of all, Ms. Schroeder, thank you so much for the presentation. I know there were a lot of options presented. I'm going to go first to Councilmember Jordan, who's been waiting patiently and I think has questions for you, Ms. Schroeder.
I do have a couple questions, but thank you, Jamie. This, Ms. Schroeder, Director Schroeder. This is a great presentation, and I know our direction at the last council meeting was to try to go back and get creative and help us to balance the myriad of needs that we all have in our community and find a way to thread the needle, for lack of a better term, And you really did that, and you got creative. And I think the wellness pass is a great option that you have put in there. It takes away this, after our last meeting in particular, I was feeling this we were almost pitting youth against seniors, because we understand both those populations, vulnerable populations, will need assistance with these speeds going forward. And it felt like we were kind of, really talking about one that might have been to the deficit of the other. And we know access to all of our populations is so critically important. So I appreciate, I think the wellness path with all of the options that you have under that was really the creative way to go, and I appreciate that. The age thing, 62 seems a little weird to me, only because 60 seems like 50 too young, 65 maybe too old. I thought 60 was more of a senior, and that's what the federal government defines as a senior. Now, they may not start paying out benefits until 62, but they define a senior as 60. So those are my thoughts on that. This kind of levels the playing field on a number of fronts. It takes away some of the one-time funding that we were trying to scrape up to get by for a year. Now, keeping in mind, when we go into budget, the world has changed, and all of these things with regards to the senior citizens, monies that they give away, the monies for youth city council, all those things are going to have to be discussed. The committees in their totality and their activations maybe through the remainder of the year, those may be up for debate during our budget discussion. So anyway, I appreciate the detail you went to try to find a way to get us there. And I thought you did a really good job. And actually I think option 2 is pretty darn comprehensive and something that looks like, certainly from my perspective, gets us where we want to go. So thank you for all your work.
Thank you.
Councilmember Breckus. Hold on one second.
Could you put on the slide with the options?
Councilmember Breckus, I apologize. There was some muting problem on our end. So can you start your question over again?
Ms. Schroeder, thank you for the presentation. Could you put on the slide that has the options again?
Yes, hang on one second. I have 3 monitors, but it looks like the clerk is going to put that slide up, or at least give me control back, and I will quickly get us to that slide.
Jamie, we'll go ahead and give you control back over the PowerPoint so that way you can navigate throughout the slides as questions come up.
Thank you.
Okay. Oh. Option 2, 50% of suggested fee increase. I think with all of the closures right now and not knowing when we're going to open and in what capacity, I think a fee increase of any sort is going to be based upon outdated use assumptions. And so I'm uncomfortable putting in a fee increase of any sort. I've also been concerned that the narrative that this is an exercise to, pay people the minimum wage is a false one. I mean, who says it's not a narrative to pay, the extra funds we need to put into the rest management fund, because it all comes from one pool of money. So I've always been really uncomfortable with that. I also am uncomfortable with adopting any cost recovery goals because that's not been our budgeting practice, and I think it's part of a bigger dialogue. And actually, in 2014, when we had the study done on the Parks Department, I think we shied away from that, and that was at their recommendation. So I'm kind of leaning toward not any fee right now, moving it to 60 or 62. I'm agnostic to that. The wellness pass is fine. I am a little concerned also that the more we stand this up as a social services program, the less support there is in the community for this being parks for all. I think that's a really important thing. I'll just go back to history was that Social Security, when it was stood up in the Great Depression, was going to be for all, so that there would always be broad support, that even the wealthiest would be eligible for Social Security. And I think that's an important principle for programs, is that they're for all. And so the more we have means testing, I'd rather see it stay low for all rather than supplement by some sort of other so-called scholarship program. So those are my thoughts, is to hold the fees because we're closed right now, recalibrate when we understand our new usage. I can go to the wellness pass. I think that's not a bad idea in the pickleball, and the age for 60, but I'm uncomfortable with the other 2 points. Oh, and also I just want to say in the pools, I think that's a tough one. What I'm understanding from my inbox being filled all week is that when the developer tears down the Lake Ridge swimming pools, that we're going to even have greater demand on us, and we may need to increase our programming for pools. So that supports my other position that we maybe are going to have other use considerations when we get through the back of this.
Thank you, Councilmember Breckus. And we're going to switch back over. And I believe Councilmember Dewar, you were up next.
Yeah, thank you. So I have a few comments. There's so much material. Congratulations, Jamie, for a very comprehensive presentation, number one. And number two, for this health and wellness pass concept, which I think has some great merit. I will tell you, it was hard because I'm not as knowledgeable about all of the recreation programs, maybe as Councilwoman Darden or Councilwoman Breckus, one working with seniors, one having been on the Parks and Rec board. So for me, I'm having to learn all of this kind of from a beginning point. It's hard to compare all the alternatives that you provided, which is if we don't do this increase, we'll have to cut 25 different items in different ways, all of which are policy choices. It was hard to grasp all of that. One of the questions I guess I've had is, why do the Parks and Rec programs have to be pay for themselves or pay as you go? We support with general fund so many programs, and I'm not sure why we've sort of carved these out as something that has to stand on its own in terms of fees. So that's kind of a basic policy question for me. As to your question about the age, I have no problem increasing the age for what a senior is, but I would like to see it done a little bit more incrementally and maybe arrive at 62 or wherever Social Security ends, because again, they have a moving scale too. I mean, now you can get full benefits until you're 67. So I think in the federal system, they use a variety of standards. If we were to take the jump, I'm leaning towards maybe just taking a jump up to 60 or some other number, but maybe not getting all the way to 62. So that's some food for thought. And basically, I would like to study this PowerPoint more. I don't know how my colleagues feel, but I feel just to sort of bounce off what Councilwoman Breckus said about where we are right now. I feel like some of the assumptions about growth and CPI, I have a feeling we're going to see a much different CPI than was originally programmed when we were doing the budget, and that it may not be in the 2 to 3%. It may be lower than that, much lower, actually. So I think we have to kind of wait and see how this shakes out. And so those are, I would either like to wait a little bit so I could digest these 20, almost 20 items that you've presented, all the different fee schedules, your PowerPoint, all the what ifs. What if we do this and what if we do not do that? And that's kind of where I am at. I think this is a very large topic. I'm willing to take a step forward, but again, I think some of our assumptions are maybe not fully baked yet. So I'll end there for right now.
Can I ask Ms. Lochner if you could address Councilmember Dewar's specific question? I mean, is this something we must pass today? I, like Councilmember Dewar, it was a lot of information and it was very well presented and very thorough, but there were many, many choices. And so I want to make the best choice I can. I'm leaning towards Councilmember Dewar's thoughts on this as well in terms of how we view parks and how do we fund them and what assumptions we've made going into it. In part, you know, I observed that we have closed all of our park facilities. So I don't know if cost savings are happening. I don't know if that would help us later on down the road. I want to see us avoid, if at all possible, you know, balancing the park's budget on our users, because I do think there is an increased need for the services.
Sure. So we don't actually balance the parks budget on the fees that parks brings in. They don't cover their costs. It's a quality of life program. But the fees are there to support the programs in such a way that it doesn't, you know, I mean, if we had no fees, then we would have less of everything else. It's all in the general fund. So general fund is general fund. And if you take from one area, you have to, you know, if you give it to one area, you have to take it from someplace else. There's just not really a lot of options of what we have now. So the fees actually offset the costs of their programs. And we don't expect them to 100% cover their costs. Some of their programs are over 100% cost covered because that's just the way they function. And some are very limited cost recovery. That's not how we build a budget. And, you know, so I hope that helps answer that question. As far as the, you know, the need to raise fees, if the council chooses, first of all, the CPI is already published. So we'd have to wait a whole nother year to get a new CPI because we use a specific one. That is, we usually I'd have to see which one we use here, probably the annual in December. And so it's an already published rate that we use then to help develop the budget and the fee schedule that we bring forward for council to look at. So if we don't raise fees, then we're just looking at deeper cuts as we go through this.
Okay, thank you, Ms. Lochner. I think that does answer many of the questions. I think also so that you can appreciate some of the questions we're asking so that the public gains a greater sense of awareness of the process and what we're going through in terms of deciding it. It's not that we don't have the capacity to understand it. It's just we want to make sure it's explained to the folks who ultimately are the end users. I think also, I guess I would come to Ms. Schroeder and ask, you know, what we're seeing in terms of usage of the health and wellness pass. For example, if I conclude as a member of this body that we need to increase fees, but we also have to make opportunities for those most vulnerable among our community to be able to access the same exact services, does the health and wellness pass provide 100% assurance that those people would be covered? Meaning, I'm not concerned about the issue raised by Councilmember Breckus about the means testing. I'm just saying if people self-identify as being in need of such a pass, and we have those passes available, where there'll be an unlimited number of them. Can you help me address and understand better that component of it? Because I think you brought that forward in reaction to the concerns we've raised, and I'm trying to see if that solves 100% of the concern that the council has raised, or if it's only solving it for one segment of the folks.
Sure. Thank you for the question. For the record, Jamie Schroeder, Director of Parks and Recreation. So we feel that health and wellness pass, because it's combining aquatics, the rec centers, drop-in activities, as well as senior activity pass, that it is going to address I wouldn't say 100%, but I would say it's probably going to address a majority of the concerns that everybody has about raising fees for those that are in need and meet our scholarship criteria. Our scholarship criteria is pretty generous. We follow the same guidelines that the Division of Welfare uses for all ages. And you know, what we want to do is make sure that there is access to our basic recreational services, and we consider those to be those the drop-in fees when you're using our different facilities. So if you are if you want to go swimming, then the basic services that we offer at swimming pools would be the lap swim or water walking for those that don't necessarily swim. They go to Evelyn Mount Northeast Community Center pool where that pool is shallow, and they still get their exercise by just being able to walk laps because it doesn't require swimming. It also, for the younger age demographic, that pass also includes access to open swim. So if you are a child and your parent wants to take you to a pool, you can do the open swim activity. And then if you are an adult or over the age of 14 and you want to go use our weight rooms, our fitness centers, this pass would allow you to be able to do that as well. Or if you are big on playing basketball or pickleball, the recreation center portion of the Health and Wellness Pass gives you access to that activity. And then with the Senior Activity Pass side of it, the Health and Wellness Pass would allow anybody that wanted to do more of our passive yet social senior activities, such as playing cards or the beanbag baseball, quilting. We have a choir group. We do a ukulele group. There's a lot of different activities that serve the purpose of making sure that our older demographic has an opportunity to get out of their homes and socialize. And a lot of the concern coming in from the Senior Citizen Access Advisory, or the Senior Citizen Advisory Committee, was making sure that we were able to take care of the seniors that were on a fixed income and couldn't afford a price increase for those social activities. And so what we've done by doing the Health and Wellness Pass is we've essentially put it on steroids, and we said, here are all the different things that we know can be subsidized by user fees for those that qualify for our scholarships. And so that was the best option that we were able to come up with that would still allow us to be able to raise the fees so that we could cover the cost of the minimum wage increase, but still take care of that the vulnerable population regardless of age.
Okay, thank you. Ms. Schroeder, I want to make sure, hold on, Councilmember Weber, I'll come to you in a second. I want to make sure I understand though, and I'm really now focused on a very small thing, which is a comment, public comment that was made by one of the folks who wrote in, Paco LaChoy, who serves on our Senior Citizens Access Advisory Group. And he has strongly encouraged us to approve the health and wellness plan or pass, as well as keeping the age of seniors set at 60. And I'm trying to understand from your perspective and perhaps Ms. Lochner's perspective, if we raise the fees according to the recommended staff recommendation, but we put in the health and wellness pass and we keep the age at 60, have we solved the financial issue? It's the easiest way I can address it.
Yes, so based on our calculations, and again, using fiscal year 18-19 numbers, by raising the fees, even if you choose option 2, which is just half of the increment, we will be able to continue operating our programs without having to do those significant cuts as of today. Depending on what the COVID-19 situation does to our economy for the next fiscal year, you know, there still may be some challenges that we have to address overall, but today, if you set the COVID-19 situation aside, staff feels pretty confident that, you know, at a minimum, doing option 2 still will meet the needs of what our community is looking for.
And one thing to point out also is that the scholarship program we had was severely underutilized, so we had a bunch of money that was on the table there to provide scholarships that was not being used. So by expanding this and adding those other functions, we think it will actually be better utilized, and we'll also be doing better outreach to ensure that people understand the program exists and that it is a benefit for them.
Okay, thank you very much for your responses. I'm going to come back to Councilmember Jordan, who's been patient there on the phone.
Thank you very much, Vice Mayor. I guess my question is this, and because everything is in such a state of flux with regard to our budget, and while I appreciate us talking about some of these fees, which I know are, have an influence on everybody that accesses our facilities, we could be having a much bigger conversation a few weeks from now. So I guess my question is there an opportunity to access the Reno Works 50,000 and maybe a portion of the Senior Citizens Advisory Committee funds to get us through our budget cycle up to and maybe through this year's budget cycle? I know we're trying to fix a structural issue, which I agree with, and that's what my motion or my inclination was to go with option 2, because it structurally fixes the go forward on some of these issues. But I'm just wondering, is there an opportunity that we can get past our budget or into our budget and then discuss this item? There's so much so much in flux right now. It's tough to wrap my head around making this decision in light of some much grander decisions we may be making very soon.
So thank you for that. This is Deborah Lochner, Finance Director. With the budget public hearing, we have to pass a fee schedule for the coming year. What that fee schedule looks like is the discussion we're having today. That's what we're here is, 1 month from now, we will be coming back to council in a public hearing to pass our budget and our fee schedule for the coming year. Not to say that we can't hold another public hearing on fees. We likely will, because once the parking study done, we'll be changing those fees associated with the parking program. So it's not to say that we can't come back and do it. We try, we typically like to come once and get the fee schedule passed for the year. There's a lot of fees in there that are not park and rec fees. So we do have to have a fee schedule passed. What we're looking for today really is just direction on what were the area that the council brought up concern when we talked about the fees in February. We wanted to make sure that we had good direction to put forth a fee schedule that you could approve on May 20th.
Thank you, and that's helpful. And I think kind of where I was heading, which some other council members have alluded to, is there was a lot of detail and information to absorb today on some of these fees. So maybe what we can do is table this item until we can get some maybe not in person, but individual phone calls to go over those with Jamie. And maybe by the time we reconvene, and maybe it is at our budget time, we can have a better idea of what the global impacts may be. I don't mean to punt the issue, but it doesn't sound like all of us collectively have enough depth of understanding to kind of move forward right now.
And
Vice Mayor.
Yeah, go ahead.
No problem. I want to come to Councilmember Breckus, but Ms. Lochner, did you feel a need to answer Councilmember Jordan?
No, it's, like I said, we're just trying to get direction, and I think if you wanted to individually give Jamie direction, I think that would work. I think Jamie can have those discussions with you guys and kind of put together a consensus of what she thinks you want to look at. But the problem is that, like I said, we're coming back on May 20th for adoption, so there's only one council meeting between now and then if you wanted to actually give direction as a body. If she gets, widely different direction, it's going to be very difficult for Jamie to put together a fee schedule for you to adopt.
Well, and for my part, and before I come to you, Councilmember Breckus, I've certainly learned a lot through the presentation today. I would be comfortable moving forward with option 2 with the health and wellness pass, but I want to make sure that my colleagues are comfortable with where we're headed. I understood so many options to be on the table, and we are trying to get to a resolution on this issue. But it's just that we are all dealing with a change of circumstance. Every time we come into the room, it seems like some other circumstances change. I am somewhat like Councilmember Jordan, inclined to not try to fix the entire 5-year hole in one swoop, because I don't know what it's going to look like a year from now. I know that we can really ratchet down and look at one particular time frame, which is this, let's just call it next year's budget. And between the Reno Works monies, the senior citizens advisory dollars, and some finagling, we can probably patch the hole for a year. But I'm concerned that the larger structural things looming, I don't think we should try to bootstrap a solution to this problem in this year. And so those are just my own thoughts. I'm going to come to Councilmember Breckus.
Mr. Vice Mayor.
Yes.
Mr. Vice Mayor, this is Bonnie.
Okay, Councilmember Weber.
Councilwoman Weber.
Yes, Councilmember Weber. Hold on one second, because I had already called on Councilmember Breckus, but I'll come to you right afterwards.
I keep asking to have, if I can have a conversation, so thank you.
Yeah, this is the first time I've heard it.
I'm going to yield my time to Ms. Weber for
Okay.
now, and then, and I think Mr. Delgado also has his hands up, so since I've spoken once already, I'd like to follow those two.
No problem. Let's go to Councilmember Weber.
Now I can speak.
Yes,
Thank
we're
you,
here.
Mr. Vice Mayor.
Thank you.
Okay, so first of all, I want to say thank you so much to our director, Schroeder, for, I've had many conversations with her now over this, and as the liaison to the Parks and Rec Commission, I was in the meetings when the commission recommended many of the items that are in phase 2. Or not phase 2, but the number 2 option. And so I would really like us to think about doing this today. We don't need to be putting this off. We don't need to keep just having the same discussions. We need to do this today, and it doesn't need to come back. I just want to suggest that. One thing I did want to ask, though, is if we even think that our pools are going to be open this next season. Because with COVID, I think you and I had this discussion, Director Schroeder. I think you might want to explain that as well.
Sure. Thank you. For the record, Jamie Schroeder, Director of Parks and Recreation. We are closely monitoring the situation on the pools, on whether or not we are going to be able to open this summer. We haven't been able to make a true determination yet. Some of the agencies across the country have made that determination to close their pools for the summer. We have not made that determination yet. We are waiting on more guidance from what the governor's office is going to say based on the medical advice that's out there. Obviously, if we have to continue practicing social distancing, that becomes a challenge in recreational environments, not just pools. It's going to be a challenge if we reopen the pool and they say that we have to mandate that 6 feet of social distancing. A majority of kids are more focused on having fun, and especially in water, it's really difficult to be able to say, here's what 6 feet looks like in water versus 6 feet in a basketball gymnasium. So we are not ready to make that determination yet, but we are definitely monitoring that situation.
Thank you. Thank you, Mr. Vice Mayor.
Thanks, Councilmember Weber. Councilmember Delgado.
Mr. Vice Mayor.
Yes, Councilmember Weber.
I don't know if I'm being heard, but I did say thank you.
Oh, yeah,
Mr.
we
Vice
heard you.
Mayor.
Thank you so much.
Okay,
Sorry, we're
perfect.
having a little technical difficulties on our end, so we're
Okay.
working on that. But I'm going to come to Councilmember Delgado. I know that your hand is raised.
Thank you, Vice Mayor. Listening closely to everyone's comments, super tough, especially with the idea that we'd be canceling out or possibly eliminating some of the other programs that are so vital to everybody. Option 2 definitely looks like something that we could possibly consider, but I'm also really considering what everyone else is having the opportunity just to chew on this just for a few more days. There's a lot of things. Director Schroeder did a tremendous job presenting some of those pieces, but I'm looking at this also from the perspective, from a healthcare perspective, in the sense where this is very much a public health opportunity and piece, in the sense where it's interesting that we're eliminating or possibly eliminating a lot of these health programs. That we just look at RDJ, see from the correlation where all the highest cases are in certain zip codes, right? So are we doing more damage overall to some of these communities that really need these opportunities too, when things are listed, that they have an opportunity to have some really organized physical activity in place? But I know cutting the line is the option 2 possibly, but I really like an opportunity to sit down with Director Schroeder a little bit more, chew through some of these initiatives, some of these items, and see where there might be some more opportunities. But definitely really appreciate the option 2 at the moment that you presented, but I really like an opportunity to put this back on the agenda on the next agenda for us to discuss versus making a decision today. Thank you, Vice Mayor.
Okay, Councilmember Dewar.
Yes, I want to support Councilman Delgado's suggestion. That's exactly what I was thinking, was that we don't need to wait till the budget, but I would like a chance to talk through with Jamie Schroeder a bit, just to make sure I understand. And remember too, we're not just adopting fees for recreation, even though that's what 20 of the items are about. We also have all the other fees, the community development, finance, fire, et cetera, courts, police, parking, public works. And so it's such a big chunk of stuff. And usually the answer when you're not really sure is you just do an incremental thing like we would do across the board CPI. And I did want to respond to something Deborah said earlier about the CPI set for this year. That may be, but I've got to believe that the economy is going to fundamentally change in a number of ways that I, for one, don't really understand yet, and I think most of us don't really have a good feel for it. I never saw a time where there would be negative fuel prices, where they would be paying people to store fuel, rather than to buy fuel. I mean, this is really unprecedented. This is something I hadn't really thought about, and how many other things have I not thought about? So I'm just asking too for a 2-week delay to our next meeting, just to look at all of these fee schedules and just have some, make sure I fully understand what we do. I'm generally supportive of the option of, a partial increase, and definitely I'm not talking, I want to be clear, Ms. Lochner, I want to be clear, I'm not recommending putting this all on the back of the general fund at all. I'm just saying that, we just have to be as thoughtful as we can, and it's a lot of information, and I'm still noodling through it all. So that's it. I like where Councilman Delgado was going on that.
Okay, I have a motion by Councilmember Delgado, a second by Councilmember Dewar. I'm going to come now to Councilmember Breckus for discussion or further discussion on this or the motion.
Yeah, I think a lot of this is more academic than pragmatic, because they just need direction to bake a budget. And we've already said we're going to go back into budget in September. And, I don't know what it's going to do to have another 45-minute discussion in 2 weeks, really, in these conversations. I think we're going to have a lot of other decision points. What I would say is we go forward with a a no recommendation of raising the rates, but raising the age of 60 and, taking, and that's it. And have them bake the budget that way. But then on the cost side, program 6 months of like zilch costs assigned, balance it how it is with the closures. Bake the closures for 6 months into the budget, because I think she can work to neutralize this. And then each time they bring us forward, what we're doing on operations, we can also balance that with the fee schedule to the new reality. So I'm afraid if the motion goes, it'll be just 2 weeks of maybe some people will get a chance to talk to Ms. Schroeder, but there won't be a lot of clarity still. And with the closures, I think she can bake a budget with the expenditures washing out, because we have a lot of the staff furloughed. I would presume the water side staff is furloughed, or the pickleball people are furloughed. So that's my thought. But if the motion goes forward in 2 weeks, I'll really be looking forward to the motion proposers to, tell us what daylight they see here.
Okay, Councilman Breckus, you are, I think, spot on in many ways. I'm still inclined to support the motion. I'm going to call for the question. All those in favor of a tabling of this item till for 2 weeks, please signify by saying aye.
Aye.
Those opposed, please signify by saying no.
I'm going to oppose.
Me too. Councilman Weber.
Yep. Okay, the motion carries 5-2.
Mr. Vice Mayor, with that, we are on item D3. This is the first of the 1,000 homes fee deferral discussion for your program today.
Okay, let me first ask, Madam Clerk, did we have public comment on this item?
Mr. Vice Mayor, we received one letter from Father Chuck Durante concerned on this item that has been submitted into the record for public comment.
Thank you. And does the council desire a staff presentation at this time?
Yeah, I'd like a presentation.
Okay, Councilmember Councilmember Breckus, it's your ward. I'm going to invite staff forward and let me see who that is. Is that?
Eric Jensen will be presenting on this item, Mr. Vice Mayor. I do not believe we have a PowerPoint submitted to us, so we will turn it over to him to give you a brief presentation on this item.
Okay, Mr. Jensen, we'll give you a second to get to the place where you're unmuted.
Does the council hear me?
Yes, we've got you. Thank you. Proceed.
Thank you. Okay. Good afternoon. This is Eric Jensen, the Grants and Fund Development Director or Manager for the city. Very briefly, this is very similar to the other presentations that the council has received regarding the 1,000 homes in the 120 days program. In this particular case, the applicant is the owner of the former Greyhound property, which is located between 1st and 2nd Street, adjacent to Stevenson. And the applicant has large plans for the area. In addition to the 1,000 homes fee deferral, he has expressed an interest to staff to eventually make a request to abandon Stevenson Street and to also acquire the city-owned property immediately to the north and to the east across from 2nd Street that is currently held in option by Jacobs Entertainment. The applicant has spoken with Mr. Jacobs and is currently in the process of negotiating an agreement with him, but also just simply ask that during this process that the staff recognize and acknowledge that he has interest in that property, and that if for some reason Mr. Jacobs does not act on that option, that he would be interested in negotiating with the city. So essentially, the proposed project there, which is a 14-story building, mixed use, with a little more than 200 units. There are some challenges, of course, with that in that location in terms of structure and cost and so forth. That's not part of this discussion, but his request essentially is for the standard fee deferral agreement of 5 years after the time of certificate of occupancy.
Okay, Mr. Jensen, is that the conclusion of your presentation at this time?
It is. Thank you.
Thank you very much. I appreciate it. I'm going to go to the council members now for discussion or questions on the item. Councilmember Breckus?
Yeah, so originally it was reported that the fee deferral would be $15.5 million over in sewer connection fees over the 5 years. Is this included within that last number of 15.5 million, these ones?
Yes, Eric Jensen. The applicant made an application in December, and so the very first numbers that the council received in January, this was included in that data.
Okay. Well, when I hear that this project would involve possibly, it's great, 14 stories, might have some shading concerns on Bicentennial Park, wants to buy some city property, wants some city abandonment, fee and money deferral of ratepayers from our sewer fund. I just cannot go there unless there's some restrictions on some of these units being restricted for subsidy affordable housing. Are any of these proposed to be restricted to affordable housing units?
Eric Jensen, for the record, this is a purely market rate project. So at this point, there have been no discussions with staff in regards to affordability.
You know what? When I hear that there's a subsidy of ratepayer funds, I don't think it's a market rate project. I think there is a subsidy, but there's not a guarantee that that subsidy is going to our vulnerable people who need better housing options. So I can't support this. Thank you.
Okay, any other colleagues have any questions for Mr. Jensen at this time? Okay, hearing none, I'll call for the question. Is there anyone who will provide a motion, please?
Jordan, move to approve.
Okay, I have a motion by Councilmember
Weber.
Jordan, a second by Councilmember
Second.
Weber. Do I have a motion and a second? Any further discussion on this item at this time? Okay, I have a motion and a second. All those in favor, please signify by saying aye. Aye.
Aye.
I'm opposed.
Hold on one second. We've had a little bit of a delay. I want to call for the question. All those in favor, please signify by saying aye. Aye.
Aye.
Aye.
Any opposed, please signify by saying no.
No.
Okay, motion carries 6-1.
With that, we are transitioning to our next item, which is D4, the second item of 1,000 homes fee deferral for 301 State Street.
Okay, this is in Ward 3, but I want to ask, does council desire a staff presentation on D4?
I have a question about this one.
Okay, let me bring, is Mr. Jensen on the hook for all of these?
That is correct. All of these are his items. There are no PowerPoint presentations, so they'll just be questions to be available for answer.
Okay, Mr. Jensen, could you let me know that you can hear us and that you're on?
Thank you, Councilman Reese. Yes, I am here.
Okay, Councilmember Breckus, you have the floor.
Was this a property that the city sold to this property owner?
Eric Jensen, for the record. The property is under contract. I don't believe that it is closed at this point, but yes, this is a formerly or is a currently city-owned property that was sold at a reduced rate in exchange for a number, I believe, 6 affordable units as part of the project.
Okay, well, I feel they've already gotten their subsidy. They came forward, they asked for subsidies, additional subsidies in time and money coming from our struggling sewer ratepayers, businesses and individuals, I don't think is validated.
Vice Mayor?
Madam Mayor.
Hi, can you hear me?
Yes, ma'am.
Sorry, I'm having some trouble with my mute. It kind of goes on and off. A couple things I want to just point out. I think the landscape is going to be extremely different. I think we are kidding ourselves if we don't think for 2 seconds that COVID-19 is going to have a massive financial impact on our real estate. And we need to do whatever we can to make sure that we continue to see projects move forward now more than ever. And I also want to be very clear, these are not subsidies, these are deferrals on the back end. That means they get repaid. I want the public to understand that so it is on the record, because it makes it look like, or there's an insinuation that developers are having a heyday. And I want to make sure everyone understands that clearly. But again, I also want to point out now more than ever, it's important to keep people working. And moving forward, jobs are going to be so critical on every job site and every business in the city of Reno. So I just want to make that clear, but I also want it on the record that these are not giveaways. These are deferrals. They will pay them on the back end. Thank you.
Madam Mayor, thank you for that comment. I also think with regard to this specific project, because I recall the origin and genesis of it, that it's not accurate, I don't think, to say that there was a subsidy given to this developer in any way already. What happened was the purchaser of the land came forward with an appraisal. That appraisal identified a value to the property, and the ultimate decision was that they would pay either full boat or they could pay a reduced fee if they put a certain number of units of workforce housing on it. And I'll defer to Councilman Delgado about the particulars of that, because as I sit here today, I'm not remembering if it's 10 units or 6 and for what number of years, and I apologize for that. But the bottom line is, from my perspective, the developer did not come to us and ask for a subsidy or any kind of reduction. We asked them to do it based on our desire to see workforce housing placed there. So this really is the first time that this particular project is in front of us on State Street there, asking for, as the mayor has aptly put it, a deferral, not a subsidy. No revenue is lost. The city is not in a worse off position by doing it. It literally is a benefit to our desire to see additional workforce housing. And so I am very much in favor of moving forward with action on D4. And I will, leave it at that and turn it over to Councilmember Delgado for a motion.
Thank you, Vice Mayor. You're exactly right in terms of the information that you provided. It was 10% of their total, the total units that they would build out would be for workforce housing. It's definitely an opportunity for us, and we saw that it was more cost efficient for the developer to take that on versus us go and try and raise the money to build that on our own. And so it's an opportunity again to provide some more diverse housing within our downtown core to allow for people to take advantage of that. And it's just the right thing to do to have some multifamily, multi-generational, multi-diverse, just general in that core. So great opportunity with some local developers to take that on for us. So I look forward to it being built in our current area that's been blighted in many different ways, and there's that many abandoned cars next to the jewel of our river. So great to see that rejuvenation happen, especially after the COVID that the mayor took it clearly on in terms of what that may look like soon into the future. So look, I want to move to approve item D4.
Second, Weber.
Okay, I have a motion by Councilmember Delgado, a second by Councilmember Weber. I'll call for the question in the absence of additional discussion. Okay, seeing none.
Vice Mayor?
Yes, Madam Mayor, you're on.
Really quickly, I just want to point out that we were in a housing shortage before, and what that really sort of means, and we've seen it, by having that housing shortage, it allows for landlords to hold people hostage. That's why it's so important now more than ever that projects move through, that we are putting out more supply because of the demand. So, and now because of COVID-19, I hope that the council does see the impact of what that can have, where landlords can absolutely hold these renters hostage. So it is important to continue to keep up with the demand, because we were short supply beforehand. So that's all I just wanted to say. I think you have to really look at the big picture now moving forward. This is going to be a critical point in our city, so we have to pay attention to it. Thanks so much.
Thank you, Madam Mayor. I believe the program at its inception, when you brought it forward some months ago, was designed to address a number of different things, and I think my hope is that it will continue to do those things, even though we have the pandemic that's weighing down on all of us. I think it's absolutely correct that we have to stay the course, not only to increase supply, hopefully to reduce overall rates across our region, but also because this particular project has a component that is designed to make housing available to a teacher or a police officer, or folks who otherwise might not have the opportunity to be into that type of housing. The project itself, I hope, will be a good one, and of course, I hope will be built in a timely manner. So your wisdom, of course, is good counsel as always. I have a motion.
And jobs. Thank you.
I have a motion and a second. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed, please signify by saying no.
Opposed.
Okay, the motion carries 6-1.
Mr. Vice Mayor, our next item is D5. This is the last item of your 1,000 home fee deferral for today.
Okay,
Again,
thank
returning
you.
it to Eric Jensen.
Well, before I do that, I want to first ask, do we have public comment?
We have none.
Okay, and I believe, Madam Mayor, you have a disclosure, and so I want to make
I
sure.
do, thank you.
Thank you.
All
We're
right.
ready.
Madam Clerk, in the interest of full transparency, I'm disclosing the fact that I have a personal relationship with Jessica Speraza. I understand she has been retained by the applicant as a consultant on the project. On this matter, I've sought guidance from our city attorney's office. I do not have any commitments or financial ties or obligations to her. Madam Clerk, please accept this disclosure for the record. Thanks so much.
Madam Mayor, thank you. Madam Clerk, do we have public comment on this item? Did I already ask that?
You did, but we still have none, so you're being extra thorough.
Extra careful. Okay, and then does the council desire a staff presentation?
I have a question about this development in Ward 1.
Okay, let me make sure that Eric Jensen, are you hearing?
I am here, Vice Mayor Reese.
Thank you, Mr. Jensen. Councilmember Breckus.
Remind me, in 2016, when the council voted and I supported a infrastructure assistance for this development from the sewer fund of about $3.5 million, do we condition it upon any subsidized restricted housing units being built?
Eric Jensen, for the record. I was not with the city at the time, but I have read through the report and through the agreement, and no, to my knowledge, there was no restriction. The agreement specifically said that the city would award a certain number of sewer connection credits that were as a result of the developer's investment into the city's infrastructure, and that the project would be given a 1-year sewer connection fee deferral as a result of the project, but there would be no deferral in building permit fees. And so what the applicant is asking for today is only building permit fee deferral because they already have an existing sewer connection fee deferral agreement with the city.
I thought on previous items here you said that we were not authorized to do building permit fee deferrals.
This is Eric Jensen for the record. No, we've always done building fee deferrals. That's part of the standard fee agreement. It was the RIF that we could not defer.
Oh, okay. And what is the deferral date to?
In this particular instance, again, this is Eric Jensen, the applicant is requesting a standard agreement for just the building permit fees, which is 5 years from time of certificate of occupancy.
Is the are properties able to be sold at that point in time before then?
Again, Eric Jensen, in our standard agreement, if the property is sold, then if they're sold as individual units, then they must pay all their fees at the time the first unit is sold. If they're sold as a project in its entirety, they can come and ask us to assign that to the new person, to the new owner, but we do not are not obligated to do that.
This is okay. Okay, and then that comes back to the council.
Correct. Yes.
Because this is the largest of these to get this approval, and they've already been before us with I think people they've already gone into deals with. So I would presume that if there's not some subdivision or parceling of the large property, there's probably some ground leases or something. Who's the agreement with?
The applicant, again, Eric Jensen, sorry, the applicant in this case is Lion Living, who my understanding is the developer of the properties, and that they're doing it in partnership with Reno Land.
Does it cover a certain component of the project? Is it restricted to certain development units or certain square footage on the premises?
Again, Eric Jensen, in the staff report, it specifically outlines which properties this encumbers. It would be Building 3, Building 1B, Building 2A, Building 2B, the Residential Market Hall, which is a mixed-use building with 12 units, and those are all the ones that are encompassed by this application.
Okay, and it's a 5-year for Lion's development on the building enterprise. Let me hear from legal on what recourse we have if this thing, if they don't pay within 5 years. What's our clawbacks? What's our legal recourse? Because we don't have lien authority under state statute, do we?
This is Carl Hall. Yeah, we are liening these as part of the program. My understanding is that we're putting a lien on recording a lien on the property. So we do.
And when you say a lien, what exactly is a lien? I know there's mechanic liens, and then we put assessment liens. Is there a hierarchy of liens?
Well, I think there is a hierarchy of liens in terms of mechanic liens and that sort of thing. But I'm not sure. Are you asking when we would get the money back, or? Yeah.
What would be our recourse? We'd have to take them into court. Would they pay us legal fees if we took them into court?
You know, we could ask for attorney's fees. Typically, the prevailing party does get legal fees, and I imagine that's, one of the things that both parties would understand, that if we get into litigation, that legal fees could be part of the damage component.
Okay.
Okay, I'm going to bring it back to the body and see if there are any additional questions from council at this time. Okay, seeing none, I'll call for the question. May I have a motion, please?
Move to approve, Jordan.
Okay, I have a motion by Councilmember Jordan. Can I get a second?
Second.
A second by Councilmember Delgado. So I have a motion and a second. Any further discussion at this time?
This is Councilmember Breckus.
You have the floor.
Thank you. I am uncomfortable with the 5-year time frame on this, and I just don't want the building enterprise fund to have to take it in the shorts. And I also feel that this project's already received a public subsidy, and I just don't think another one's warranted. I'm concerned that that this one has already had its shot, and it's an inequitable approach to some of the other little projects going on. So I'm not going to support this one still.
Okay, I have a motion and a second. All those in favor, please signify by saying aye.
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 Vice Mayor,
Yes, Madam Mayor.
all I want to say is we got to start thinking about jobs. So anyway, thanks so much. I appreciate it.
And Madam Mayor, I apologize. I saw that your hand was raised, but I just didn't catch it. And so I apologize.
No, it's fine.
I'll call for the question
Thank
again,
you.
though. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed, please signify by saying no.
Opposed.
Okay, motion carries 6-1.
Mr. Vice Mayor, we've already had item D6 as a presentation earlier. Moving on to item D7. This is a presentation and discussion on Reno Fire Department's response to the COVID-19 pandemic. This will be a discussion from Fire Chief Dave Cochran, and I believe we do not have a PowerPoint, but he is available and unmuted to give you information.
Okay, welcome, Chief Cochran.
Meeting. Thank you, Vice Mayor Reese. I'm returning following the April 13 meeting with the information requested by Council. Council's been provided with a memo because of the level of detail. I wanted to make sure they had that in advance. And in particular, our drawdown plan, the plan that was put on the overhead at the last meeting is now in Council's possession so they can look at it closely. That is a plan we've had in place since the beginning of this event. I'll go over the highlights of the memo, and then I'm certainly available, as is my staff, for some questions. I have members of dispatch here as well, and I believe Chief Benzon, who oversees dispatch, is on the line as well. So with that, starting with the emergency drawdown plan, the Reno Fire Department's primary goal is to staff to provide the highest level of service to the citizens of Reno. The attached, or the provided, is one that the department will utilize in the event that the department experiences a staffing shortage during the COVID-19 event, or really any other event of a serious and catastrophic nature. As I mentioned previously, while this matrix will develop in connection with the COVID-19 event, it's important to note that we go through this exercise of staffing to the appropriate level to provide the best service possible on a daily basis, whether it's an event like this, a wildland fire, or simply a request for assistance from a neighboring jurisdiction. The attached matrix contemplates a reduction in daily staffing caused by a significant reduction in staffing, again, due to the COVID-19 event or any other significant event that could not otherwise be mitigated by recalling personnel on overtime. One of the other topics that a question was raised about was the issue of priority 1 and priority 2 calls. Right now, we go to priority 1 and 2 calls. Our staffing has not been impacted by COVID-19, and currently, no other jurisdiction has reduced the priority levels of the calls that they respond to. In the opinion of myself and the union leadership that I've been in communication with, there is no necessity to restrict the service levels that we respond to at this time. There has been a discussion about EMD in connection with the prioritization of calls, because that is how calls are actually prioritized. If we're being quite literal, every call that comes into Reno Dispatch is a priority 1, because that is the only priority they assign calls. They assign it to a priority 1 if we respond. Otherwise, there is no. The issue of EMD to Reno is not new. A number of studies over the year have recommended a consolidated dispatch that utilizes EMD, including the CPSM study that was recently completed and the Tri-Data study dating back to 2012. But these studies go back farther than that. They go back to the late 80s. The current process of transferring calls back and forth results in situations where fire and law enforcement do not receive timely, accurate information. Again, this is not a new issue, but it's being highlighted and exacerbated by the COVID-19 event. The other issue that was discussed at the April 13 meeting was the possibility of using a plectron system similar to the system that is in place for the county and for Sparks at our dispatch. In speaking with dispatch supervisors for Reno, and I have them available for questions if that comes up. That system was abandoned approximately a decade ago in Reno because of the detrimental effect it has on not only fire service, but law enforcement service. Reno dispatch receives almost 500,000 calls a year. The high call volume and the constant interruptions generated by the Plectron system, with dispatchers already engaged in other calls, creates a situation where the attention of dispatchers was constantly being drawn away from the tasks they were already performing for the Reno Fire Department, causing a degradation in service. This had the secondary effect of creating inefficiencies and lower service quality with police dispatching as other dispatchers attempted to manage the distractions caused by the Plectron. So it's our recommendation, the recommendation of dispatch, that that system not be reintroduced to Reno. The final topic that was discussed and additional information was requested was the issue of death benefits for any firefighter who succumbed to COVID-19. There are a number of benefits available to firefighters, whether injured or through a line of duty death through the city. The city has made a commitment to pay out the COVID-19 death benefit on behalf of the city if that were to occur. The other area where there would be a potential benefit is under workers' comp. Currently, these laws establish certain diseases are presumed automatically to have been contracted in the line of duty. COVID-19 is not currently one of those diseases that is a presumed contraction in the line of duty, but there are conversations going on at state level and the federal level, either by decree or through the regulatory process, to establish that a presumption may be had for a disease or for an injury tracked to COVID-19. So with that, like I said, those are the highlights. I would welcome any questions or any questions for my staff or dispatch.
Okay, Chief, let me just transition back to the other screen so I can see who has their hand raised. Give me 1 second. Okay, we've got it now. I guess I'm going to start, Chief. I want to understand, Chief, what, with regard to EMD specifically, it appears to me, based on the last several conversations that we've had, that there have been recommendations going back 10, maybe 20 years to fix EMD. And I'm not suggesting that we have to do that in this presentation, but is there a sense of how we emerge from this crisis stronger and better equipped to deal with the kinds of medical crises that are inevitable as we move forward and grow as a community? I don't understand ultimately the discussion of EMD has been sort of couched within this broader discussion, but I want to understand from your perspective where we are going to move or need to move with regard to this issue.
The context of the COVID-19 discussion, but it wasn't created by COVID-19. Just a short recap, EMD is a process by which a call comes into dispatch, any dispatch. It goes through a flow chart of questioning to determine the priority of the call, the nature of the call, and the priority of the call. And that is where you get the best information, the most efficient way to collect that information, and the quickest way to collect that information, so you dispatch the right resource to the right call. And the issue that we have here in Reno is our dispatch does not do that. I know that we've had studies going back 3 decades that recommend it. I know our dispatchers support it. It's not something that's going to happen overnight. It is a very common, it probably is not an overstatement, states the standard in the industry to have EMD. It is a program that we would need to implement into our software, into the hardware or dispatch system, and then it would require training for dispatchers. So it would take several months at least to implement the system, but I know fire and I believe police would benefit from the implementation of that system once we had it in place.
Well, and that being said, Chief Cochran, how do we get there? Like, is it that we have to spend X dollars and those dollars are going to be reimbursed to us? I'm trying to understand the mechanics of that again, I don't think it necessarily is a function of this crisis. I think this crisis has highlighted a concern. And the mayor's original concern on this issue, I think, was about making certain that our employees, the men and women of your department, are safe, right? I mean, that's how this originally arose, is that there was concern about your folks being exposed. There was concern that if your people were exposed and a whole department or a station were closed because of that, that as we approach wildfire season and our own medical needs, that we were essentially spreading ourselves too thin. And the idea, I think, was that EMD would get us there in some way. Now, again, I'm not suggesting I have the answer on EMD. I'm looking for a path forward so that we can stop chewing on this question every 6 months, a year. It just has come up a routine number of times. And so I'm looking for sort of a solution.
The question, and I like the way you phrased that, COVID has highlighted this issue, and it's really brought it to the forefront. The mechanical answer to the question, I think you asked, what are the mechanics of getting this in place and what does it cost? I mentioned the software, the hardware. We would need to purchase that, but I will tell you, and I can tell you a real life example here in our community, the county uses EMD, and the E911 board paid for EMD, and they pay the annual fee. So ultimately, the cost would be zero. We would pay it, and we would get reimbursed. And then there's the training costs, like I said, for our dispatchers to utilize EMD.
Okay, thank you for that. Let me come to my colleagues, Sorry, we're again having a bit of a technical difficulty. Hold on one second. Are there any questions by council? If you can just wave your hand at me physically. I'm not seeing the button pop up, so we'll stop there. I think ultimately, and while we're waiting to see if anyone would like to have additional inquiries on this topic, Chief, I thank you for your presentation. And I would just say, ultimately, long term, I think we're going to have perhaps a stakeholder meeting with electeds to figure out the dispatch issue, right? Maybe once and for all. We may need to lead, I don't know, but I'm looking for this not to be kind of the reoccurring question. And so those are just my thoughts on the subject. I'm going to come now back to the body. I think we've gotten the computer system worked out. Councilmember Dewar, I think, is ready to go.
Thank you. Sorry. I guess my question is just this. It seems that we've just about said it all and done it all when it comes to the dispatch. And it just seems that we just need to move forward and do it. So I don't know that we need a lot more conversation about it. I mean, it sounds, Chief, that I'm a little unclear about this electron system and where that plays in. I don't understand. I have to say, even after all this conversation, I don't understand why we can't get there. Washoe County seems to have gotten there, Sparks in some way. So that's where I'm struggling. And I don't particularly want to talk about that much more. I just want to give you the direction that I think the council's already done to go get it done. So you can respond, but I'm just telling you I'm not going to have a debate or something.
No, I thank you for the comments, and I accept the direction. I agree. I think we just got derailed because we were just about on the verge of kicking that off when COVID hit.
I understand.
Madam Mayor, I think that when we last met, one of the concerns that you raised and for which we pushed this agenda item out a bit of time was your concern that we hadn't heard yet from local IAFF 731. And so I think President Dan Tapia is on the phone, and I don't want to put him, or he's in the meeting. I don't want to put him on the spot, but we did invite your presence here. And so I'm going to see if I can technologically bring you into the meeting. Give me 1 second. Okay, President Tapia, I know the mayor had asked to have you here, and so would you like to speak on this item?
I would, and thank you. This is For the record, Dan Tapia, President, Reno Firefighters, Local 731. I'm just backing up what the chief said, how important this is. This is a major safety concern for both the men and women of your fire department and the men and women of your police department. This is a huge issue that needs to be addressed. Like we've all said, we've had studies, that most of which the city's paid for since the late 80s, that have all said we need to fix it. So I heard the question, how do we do it? Well, in my opinion, in our opinion, it needs to be included into this budget, the 150,000, give or take. I'm not sure exactly on that number, but and then that gets repaid back to us 100% in the same fiscal year. So fiscally, there really is no reason to not do it. Implementing the city of Reno EMD dispatching system eliminates the dangerous practice of not having real-time information due to the transferring of calls. It's huge for us. It's huge for the police. Your public safety is hugely relying on it. I appreciate Councilwoman Dewar's remarks on wanting to get it done. We just need to include it in this budget and make it happen. Thank you.
President Tapia, thank you for being here. If you'll go back on mute. I thank you for that additional consideration as part of the conversation. This item is not styled for action. It was, again, a presentation. So I'm going to ask my colleagues if there are any additional comments or concerns at this time. I think we've given good direction to our fire chief, and I thank him for the work he's put in on getting us here today. Okay,
Vice Mayor?
Madam Mayor, there you are. Thank you.
Sorry so much, but thanks so much. So I'm going to assume, and Chief Cochran can kind of just clarify this. I'm going to assume, we are seeing that curve, we talked about it today, start to flatten. And so I'm hoping because of that, it, puts our public safety responders in a better position. However, I'm going to assume that you will let the council know if an additional step should kick in, that if we should get to a capacity where we're not exhausting our workforce so that they can respond to the crisis at hand, I would imagine you have that trigger point. And would you just keep the council apprised of what that looks like so that, we can make sure we're continuing to be aware of the situation and how we're protecting our police and fire? Does that make sense, Chief?
Yes. Sorry, Mike, I got kicked out of the meeting. Can you hear me?
I can.
Okay, good. Yes, thank you for that, Madam Mayor, and I apologize. I meant to identify the trigger because I know that been a concern of yours. I discussed this with President Tapia on several occasions. And the trigger, if we got down to a daily staffing of 40 people, that would be the trigger to either reduce or eliminate the EMS calls that we go on. But we made a commitment to each other to talk about if we're on the right track, if our staffing goes down by one person. So we're going to be looking at it literally every step of the way, and I will make that same commitment to council to come back to you if we have any issue or significant change that you would want to know about.
Great. So, thanks so much. I appreciate it.
Okay, thank you, council members. I'm going to close this item and presentation on D7 and come back to Madam Clerk.
Mr. Vice Mayor, with that, we are transitioning to item D5. This is direction to staff and possible appointment or ratification of Jason Soto as acting city manager. This is D8.
Right, D8 for the record. Okay, let's say first, Madam Clerk, do we have any public comment on this item?
We have none, Mr. Vice Mayor.
Okay, thank you so much. Does the council desire a presentation on this item?
Maybe we could discuss this among ourselves a little bit.
Yeah, absolutely. I was just seeing, I don't know that there was a formal presentation planned. And so I'm going to start and come to Madam Mayor. I think, I'm sorry, my, my eyes, there we are. Okay, I see it now. Madam Mayor, the floor is yours.
All right, thank you very much. I think during this time, obviously, it's incredibly challenging, and we have we're in a position where our city manager, newbie, is leaving, and Bill Thomas has already exited. But I think now more than ever, because of the emergency that we are under, that we need someone that really can understand what type of, I think, demeanor, and also someone that is used to dealing with constant emergency and crisis. And therefore, I would support having Chief Soto as our interim city manager. And I think he's proven to be a leader. He's done a tremendous job, and it's hard to believe 5 years, I believe, that he has been our police chief, and it seems like yesterday. And so I'm really proud of the work that he puts in on so many different levels. And, he's astutely aware of the city as a whole. I think that he also has relationships with all the council members that are critical. I think, he loves the city and will do a tremendous job. And one of the things that he has that I think is really important, he understands mental health. And I think, now more than ever, for him to have sort of that background in mental health also is incredibly helpful. He has background in budget, background certainly in crisis, kind of, police chiefs do. That's sort of their demeanor, and they're constantly in crisis mode. And he's, been incredibly calm and helpful throughout this situation. And I think it would be a good balance for the council. And I certainly welcome all council's input on this selection, and appreciate you taking the time.
Thank you, Madam Mayor. Councilmember Breckus.
I don't have a whole lot to offer except echo what the mayor just said and give her some credit for identifying his leadership early on. I can't believe it's been 5 years either. So I want to give credit where credit is due. But as others talk, I do want to bring up somewhat of the mechanics of this that I think the staff report raised and Ms. Dewar raised last time. But other than that, I'll yield the floor right now.
Okay, thank you, Councilmember Dewar.
Yeah, I want to thank the mayor and our city manager for bringing forward this proposal for Chief Soto to be the acting, I guess it's called acting city manager. I think he would do a terrific job. And I think he has really shown that the support and trust that we placed in him 5 years ago to be the police chief has borne out. I mean, he's done a terrific job. He's built great relationships on the city council. He's built great relationships in the community. He's built great relationships on his team. And I think he's the exactly right person at this moment in time that we need to take the reins. The details, as Ms. Breckus mentioned, might need some tweaking, but I'm pretty happy. I mean, I reviewed the staff report again, and I understand basically where our attorneys are coming from in terms of the style of appointment. We can always revisit it later if, we're at 5 months and we haven't progressed far enough along with our permanent search. So I'm satisfied with the procedure outlined by our attorneys, and I would really embrace Chief Soto joining the management team in this other role at this moment in time. Thanks.
Thanks, Councilmember Dewar. Councilmember Weber.
Thank you, Mr. Vice Mayor. I'd just like to suggest that this is really, I believe, being one of the newbies, a great appointment And I thank the mayor and actually the manager for both of them for recognizing that Jason Soto is definitely a great person to fill in and do this job, bring us all together. So thank you.
Councilmember Jordan.
Thank you very much. I too commend everybody involved with bringing forth Chief Acting City Manager Soto. The titling is. I'm interested in hearing about some of the mechanics as well. And I think for the record, getting somebody to say that kind of what, and of course hearing from the chief himself as to, you know, the leadership at Reno PD and what his future, you know, goals are with the city in this interim, and then how the search moves forward and on what, you know, sort of timeline. I think it's important that we kind of wrap all that together, because some may be seeing this for the first time and maybe scratching their head going, what is happening? So does that mean the search stops? Does that mean what happens at the police department? And I think it's important that we get kind of those mechanics and that framework out to the public during this meeting, because I think it will provide a sense of understanding and comfort, which right now everybody is desperate to get right now, is a level of comfort. And I think that's what, if you were to describe the rationale and the reasoning behind Chief Soto in this interim city manager role, is precisely that. We are looking for that type of leadership that understands leadership, understands communication, understands the pulse of the community, understand how important it is to provide guidance and hope at all levels, and has respect for the community he has earned over his many, many years at the department. Great choice, and I thank you, Chief Soto, for stepping up and stepping the gap. I have no doubt this was not, you know, something that you took lightly, but we appreciate you stepping up as you always do. So thank you.
I'm going to come to Councilmember Delgado.
Thank you, Vice Mayor. I think everyone's covered just about everything, so I won't belabor the process. We're looking forward to the mechanics and the details in terms of what this is going to look like moving forward. But really excited to have Chief Soto take over in the interim, and I look forward to working closely with him.
Thank you to all of my colleagues, and I'll be brief. We'll turn it over to Manager Newby about some of the mechanical questions that all have asked about. I think it's important to pause here for a minute and just, number one, I would like to thank Ms. Newby for her leadership over these many years, and thank her for bringing our city to a place where it is today, which I think is a better place than when she got here. I also think it's important to acknowledge, and wish Ms. Newby well as she embarks on her next adventure, because I think it's always a good thing to wish people well as they move on. And so thank you, Ms. Newby, for everything that you've done for our community. And I know that you'll still be here for a number of weeks, and that we have some things that we've got to get wrapped up. I will, for my own part, say, I think, Madam Mayor and Ms. Breckus' early identification of Chief Soto as a candidate and someone that they would trust with the city gives me a high degree of confidence. Not only that, I've had the privilege of knowing Chief Soto for many years and watched him both grow and develop as a human being, as a father, as a friend, as a brother. All of those things are important. And as we look at where our city is today and where we have to go in the next several months, I think that Chief Soto will be up for the task. I think it will not be an easy task. I think there is a lot of work to do, a lot of management that will need to be done of ultimately some of our most valuable resources, and perhaps our most valuable resource, which is our people. And so I am honored by both Ms. Newby's commitment to our community and by Chief Soto's willingness to step into this role. And so I thank him and each of the staff each day for the hard work that they do put in. And I'll turn it over now to Ms. Newby for a discussion of the mechanics.
Thank you, Mr. Vice Mayor, and thank you for all the kind words. In terms of the mechanics, my departure date from Reno is June 1, as it's stated in the staff report. I would turn over to Jason Soto as interim city manager May 11th. And at that time, I would be on administrative leave through the balance of that time till June 1. At June 1, which is my departure date, then that starts the clock for the 6-month to fill that position for the city. So that's kind of it in a nutshell. I would offer to Mr. Shipman or Mr. Soto if they have anything to add.
For the record, John Shipman, I think that's it from legal unless there's specific questions.
Well, let me come back to the body and make certain, because I believe that Councilmember Dewar might have had a specific question and perhaps Councilmember Breckus as well, but I'll start with Councilmember Dewar.
Just a brief question. Initially, when I heard, I looked at the 3 options. I was looking for an option that would toll the charter's requirement that a permanent city manager be appointed in 6 months, because I am not entirely confident that we can actually finish this job in 6 months, because I don't believe we're going to start this process for a couple months. And then just with the travel restrictions and so on and so forth, and even when you usually find someone, they often ask for a month to either leave a job or move or do something so they can take up position. So I had been initially looking for something again that would toll the 6 months, and basically not have the clock start running now, or start running May 11th, or start, I guess the way Ms. Newby put it, start running June 1st. I mean, it is what it is. I looked at the options. One thing I was a little bit confused about was it says that if Jason Soto is an acting manager, he would still remain as a police chief. At least that's what's laid out in the memo. And I had thought that he would designate someone to be an acting police chief, just like where we have Arlo Stockham appointed as the acting assistant city manager, and he's appointed Angela Foos to be the acting community development director. So I wondered if someone could address that.
I'd be happy to address that unless Chief Soto would.
Yeah, I can address that. If ratified, Councilwoman Dewar, I would name an acting chief here at the department. I have, as all of you know, a very competent staff of exemplary employees that could certainly manage the department during my departure. I do that now. For example, when I went on FBI training, I was out of town for quite some time. I named an acting. You have to do that in this type of position, because there has to be somebody within the department that has that ultimate authority to make a decision when it needs to be made.
Okay, well, in the memo, it says Mr. Soto remains police chief while serving as acting city manager. So that's what threw me.
Councilmember
Yeah, I would still have my title as the police chief, and I can get into that a little bit. I've said since this was brought up, my heart is with the police department. It always will be. My responsibility is with the city of Reno. And when this was brought to my attention, I had made it clear to city manager Newby that I would take this role on a temporary basis until such time we could find a permanent city manager and start that search. Right. And if I took on the acting role, it allows me to keep that to where I wouldn't have to reappoint myself and go through some hoops and some challenges for this council. And I do have the ability to name an acting, and I do so right now, even as your chief of police. But that being said, I would transfer that authority that I have as a police chief to whoever our acting chief is, while I'm not, because I'll be working over at the city, obviously.
Right, there was that, and there's just the fact, I mean, there's co-location issues. It seems like the chief needs to be with the police staff, even the acting chief. And it also seems like there's a lot of day-to-day that has to be decided that doesn't necessarily involve the city manager, and I think you can relate to that. I know that it wouldn't be a full delegation because you would still be there, able to consult, but I was just trying to get clarity on this words on this page, and it seemed to say that there wouldn't be an acting chief. So thank you for clarifying that. It makes sense to me. Thank you.
Mr. Shipman, can I just ask too, I make an assumption that this is also tied very intimately and directly with PERS, meaning our Chief Soto is currently in one particular PERS category and classification related to his service in the police and fire PERS, which is different than he would be if he were in a different PERS classification. So I assume we're trying to navigate that as well. Is that accurate, Mr. Shipman or Mr. Hall? Yeah.
Yes, for the record, John Shipman, that's exactly it. It would be, to Councilmember Dewar's point though, this is for just this period of time. You can always revisit it and come back with an interim appointment or a permanent appointment at a later date. But at this point in time, where the chief is in his career arc and where this, this responsibility is falling, the acting role made more sense from a PERS standpoint.
No, that's totally fine. I get it. And also there was no mention of, any kind of step up in pay. To be honest with you, I don't know what the chief's pay is. I don't know what exactly what the manager's pay is. I know approximately. Often when people are acting up, so to speak, into a different position, they will get an increment up to 10%. I didn't know if that was envisioned here or if that's a later conversation. So.
Ms. Newby?
Again, John Shipman, I think that at this point is kind of a later conversation, but I mean, I'd leave that to the parties. So.
Thank you, Mr. Shipman. I appreciate that. Let's go to Councilmember Breckus.
Yeah, thank you. And I hadn't thought about the PERS component being different. Let me ask you something. And I do think that, if he's the confirmed chief, he is the confirmed chief, and he shouldn't have to, when he goes down, be reconfirmed. I mean, I think that's not a good intent. But the manager is put on contract. Is there a problem with the council putting him on a contract? In my world, it would be 9 months. And it's called, contract, city manager contract. So the charter issues put aside, but in the parameters of that contract, he would get, the percentage for acting up, his PERS, classification would stay intact, and he would be called city manager with the full authority to also be the chief, the confirmed chief, and with, all those rights that infers, which is, putting on a acting chief. I would not mind seeing that contract for like a 9-month period. So he is the city manager with a contract to toll the charter requirements. Is that just, you can't have both ways, legal?
Yeah, that with the discussions with the PERS, the issue becomes what is his primary employment, and if it is the city manager, and that's evidenced by a contract, then that becomes problematic and forces a reclassification. The way it'll work now is that he receives his base pay in salary as a public safety employee. Then the amount of act up pay that he'll get on top of that will be non-PERS compensable. And so that keeps the underlying classification intact, and it doesn't reclassify him as to a city manager position. So.
Yeah, and I get that. I had not thought about that, and I appreciate that. But then that puts us in that 6-month situation.
So to Councilmember Dewar's point, though, again, you can revisit this at any time. So, and
okay.
things may change, with Mr. Soto, with other, what's going on in the city, COVID, everything. So I think the pitch would be it gives you, the council, a lot of flexibility at this point.
Okay.
And so
Okay.
I offer that.
Okay. That sounds good then. Okay. Thank you.
Thank you to each of my colleagues. I'm going to come back to Madam Mayor.
Thank you. Sorry, I was on mute. All right, so I would like to make a motion to put, as the Councilwoman Jordan said, I don't know what it's, Chief City Manager, I don't know, Chief City Manager Soto in the position of acting city manager.
I'll second Dewar.
Okay, I have a motion by Madam Mayor and a second from Councilmember Dewar. I'll call for the question. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed, please signify by saying no. Motion carries unanimously.
Mr. Vice Mayor, with that, we're moving on to item F1. This is an ordinance adoption to be read by the city attorney.
Can we just pause for a minute? I want to say thank you, Chief Soto, for stepping up and standing in the gap, and we look forward to working with you.
Thank you. And if I could just say real quick that it's certainly a privilege and an honor of mine. I wanted to thank this council, but I also wanted to thank our current city manager, Saber Newby, for a lot of her wisdom and leadership qualities that she's shared with me over the past several years. And then I also want to thank our community. This community is important to me. I certainly have been talking with all of our community. I know I share the same desires that this council shares in terms of working through this COVID-19 so that we can get back to business as usual for the biggest little city. So thank you very much. Thank you.
Thank you, Chief, and Madam Mayor. I apologize. I'm sorry, Madam Clerk. I just wanted to pause there and give the Chief an opportunity to weigh in. Where were we?
If there is nothing further, we're on item F1, which is an ordinance adoption to be read by the city attorney.
Okay, Madam Clerk, do we have any public comment on this at this time?
We have none.
Okay, Mr. Shipman or Mr. Hall?
Thank you, Mr. Vice Mayor. This is ordinance adoption, ordinance number 6561, ordinance confirming the proceedings taken in providing for certain sidewalk driveway approach and street improvements in the city of Reno, Nevada, 2019 Special Assessment District Number 1, providing for the payment of the cost and expenses of said improvements, providing for assessing the cost of said improvements against the parcels of land benefited by said improvements, describing the manner for the collection and payment of said assessments, and providing penalties for delinquent payments, together with other matters properly relating thereto.
Okay, in the absence of any discussion or questions from council, may I have a motion, please?
I have it. I'll just refer my same disclosure that we did before on this one.
Oh, yes, thank you. I apologize. I should have asked that. Thank you, Councilmember Breckus. May I have a motion, please?
I'll move.
I have a motion by Councilmember Breckus. Do I have a second?
Second Dewar.
Okay, I have a motion and a second by Councilmember Dewar. All those in favor, please signify by saying aye. Aye.
Aye. Aye.
Any opposed, please say no. Motion carries unanimously.
Mr. Vice Mayor, we're on item G11. This is appointment to the Tenant Issues and Concerns Citizen Advisory Board. Should be noted for the record, we did receive public comment from Carol Crane wishing to be considered for the item. And with that, this has been submitted to council for the record. Open appointments at this time are Councilmember Dewar, Councilmember Delgado, and Councilmember Jordan.
Okay, let me start with Councilmember Dewar. Councilmember Dewar, are you in a position and prepared to make an appointment?
Yes, I am.
Okay, go ahead.
Yes, I'd like to recommend Susan Vasquez, just to let my colleagues know. She is the executive director of the Nevada Apartment Association. She works all over the state, and she has shown a real interest. Well, the times I've met her and the conversations I've had with her, she's shown a real interest in both the tenant side and the management side. And I really think she'd bring a good balance forward in terms of understanding all the issues. She also worked on the, you may remember, we sent some recommendations to the governor on rent, evictions, mortgages, foreclosures, those kind of things. And she was a very active participant in that as well. So I thank her, and she's my recommendation for the board.
Okay, I have a motion by Councilmember Dewar with regard to Ms. Vasquez's appointment. Can I get a second? Okay, I have a motion by Councilmember Dewar, a second by Councilmember Jordan. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? Motion carries unanimously. Congratulations to Ms. Vasquez. Councilmember Delgado, are you prepared to make appointment?
And thank you, Vice Mayor. I move to appoint Abriana Robles to the tenant board.
Okay, I have a motion by Councilmember Delgado. Can I get a second, please?
Second,
Okay, I have a
Dewar.
motion by Councilmember Delgado, a second by Councilmember Dewar. All those in favor, please signify by saying aye.
Aye.
Aye. Any no?
Aye.
Motion carries unanimously. Congratulations. Okay, at this time, I think that's all we have for this item.
Mr. Vice Mayor, at this time, we will transition to item G12. These are the approval of the Tenant Issues and Concerns Citizen Advisory Board bylaws.
Thank you. Does council desire a staff presentation on this item? Okay, thank you. Madam Clerk, do we have any public comment on this item?
We have none.
Okay, I'll call for the question. May I have a motion, please?
I'll move.
Okay, I have a motion by Councilmember Breckus, a second by Councilmember Delgado. All those in favor, please signify by saying aye. Aye.
Aye.
Aye.
Any opposed? Nay. Motion carries unanimously.
Mr. Vice Mayor, transitioning to item H1. These are updates from boards and commissions from council members.
Okay, I'm going to begin with Ward 1, Councilmember Breckus.
I don't think I have any. Thank you.
Okay, if you come up with one when we circle back, let me know. Councilmember Dewar.
Yeah, I would just report, and we may have reported on this before, but just to reiterate that the flood project, Truckee River Flood Management Authority, agreed to use their lands for the trailer site for 300 rooms for patients who may, or excuse me, for people who may have to isolate due to contracting COVID-19. And those, as far as I understand, all 300 rooms are ready to go as of the end of this week. The whole site's been ready to go. To my knowledge, no one has taken occupancy yet. I think that's all I have to report today.
Councilmember Dewar, thank you for that. What an incredible project, and boy, there are lots of people to thank. I thank you for your leadership on that body, and I know that there was a lot of work and thought that went into it. Thank you so much for that. Councilmember Delgado.
Nothing on my end.
Thank you, sir. Councilmember Weber.
Can you hear me?
Yes.
Oh, thank you. I'm sorry. I thought I was muted. Thank you. I don't have anything to say. I don't have anything in Ward 4.
Thank you, Councilmember Weber. Councilmember Jordan.
Nothing at this time. Thank you.
Okay, Madam Mayor.
Sorry, no, nothing at this time.
No, thank you. And I have nothing at this time. Seeing that we've reached the end of this, I want to just go to Madam Clerk. What's our next step?
Mr. Vice Mayor, at this time, I would make a recommendation that council recesses until their 6 p.m. hearing. We will then come back and hear from your appellant scheduled for 6 p.m. We will then take your closing public comment and then end our meeting. So at this time, I would recommend recess and then ask that everyone is promptly back ready to go for our 6 p.m. hearing, in which our appellant will be contacting and coming in via the Zoom meeting and presenting through that method.
Okay, I want to, we will go into recess here in just a second, but I also want to just pause for a moment of silence. As many of you know, today would have been the 82nd birthday of Mayor Bob Cashell, and so I would be remiss not to mention it here in these chambers today. What a friend of Reno and this community, and we wish Nancy, his children and grandchildren well. So we'll pause for a moment of silence before recessing for the evening. Okay, thank you. We'll stand in recess.
Madam Mayor and Council, we are just waiting for the last council members to log in for access, and we will reconvene your meeting in just a minute or two.
Welcome to Zoom. Enter your meeting ID. Enter your participant ID. Meeting now. There are 16 participants in the meeting.
Folks had lost the call in chambers, so just give us a second to get it back on, and then we'll be ready to go.
All right, Mr. Vice Mayor, we are ready to reconvene your meeting whenever you are ready.
Okay, thank you. I'm going to call this meeting back to order. Madam Clerk, are we just starting with the public hearing? Aye.
Yes, Mr. Vice Mayor, we are on item I-11. This is an appeal scheduled for 6 p.m. for Caliber Collision Electric Fence. This is an appeal of the Planning Commission's decision to deny a request for a variance.
Okay, let the record reflect that the City Council is opening the public hearing on item I-1, LDC case 20-00031. Madam Clerk, was proper notice given? Any correspondence received?
Mr. Vice Mayor, proper notice was given and no correspondence was received on this item.
Okay, thank you. And I don't believe any council members have disclosures, but I'll ask if there are any at this time. Seeing none, I'm going to invite a staff member forward to make the presentation. Ms. Foose, is that you this evening?
Mr. Vice Mayor, it is going to be Angela Foose. Will be given a brief introduction and overview of the appeal. I do not believe she has a staff presentation. There's a brief staff presentation that we will put forward and give her control to be able to manage that information.
Okay, and I understand and can see that the applicant, Mr. Michael Pate, is present and will have an opportunity to make a presentation after Ms. Foose.
That is correct. We will transition ownership over after such time that she's done.
Okay, thank you, Ms. Foose. We're ready for you when you are.
Mr. Vice Mayor,
Yes, Councilmember Weber.
I can see her on the screen. I don't know if you can. And it looks like she does not have volume, or she doesn't know that she's being called on.
Yeah, we're working on that.
Okay, I just wanted to. Thank you.
Just give us a second. I know that we'll reach out to her. While we're working out the technical difficulties, can I ask my colleagues, does anyone have questions for the staff, or is a presentation a needed component of this appeal this evening?
Mr. Vice Mayor?
Member
Yes, I'm interested in a presentation. I see it's a short one, but I have I've reviewed the staff report and I'd like to find out a little bit more from staff.
Okay, Ms. Spruce is getting on now, and I think she's we're close.
Angela, we are showing that you are unmuted now. Do you see us and have access on your end?
It looks like she's logged off and will be logging back on. So let's give her a second to log back in. The system did the same thing to me, and so it might take us just a minute, and we'll get her back on.
Vice Mayor Reese, by the way, this is Hillary. I'm on, just so you know.
Oh yeah, we saw you there from on. We're just getting loaded with the staff presentation. Ms. Spruce, I think, is logged back on and is here by video, but we don't have sound yet.
Can you hear me
now we have sound. Yes, we have you. Thank you, Ms. Spruce. The floor is yours for the presentation.
Great. Thank you. For the record, Angela Foos, Acting Community Development Director. The hearing before you tonight is an appeal. This is a request for a variance that was heard by the Planning Commission. There are two pieces to this variance request. They're both related to fencing. So the first piece is to increase the allowed height for a fence. Currently, our code provides or requires that fences within this community commercial zoning district, the maximum height is 6 feet. The applicant was proposing to go up to 8 feet. And secondly, the code requires that all fences within front yards have a maximum height of 4.5 feet, and they're requesting to go up to 8 feet within that front setback. There were two pieces to this appeal. The property is located in generally a commercial area. This is off Harvard and Automotive Way. This is near Mill Street. The property to the north is, well, to the northeast and west is generally developed with similar type uses, auto mechanic, auto repair type uses. The project itself does repairs, auto repairs. The property to the south is zoned NF30. It is undeveloped. So to better illustrate what's happening with this application, the line in red is the existing fence. This is an existing site. They're currently operating. They have concerns because of theft in this area, and so they are asking to add an additional fence. That additional fence will be electrified. Our code does not have any specifications on electrified fences, so that is not part of this variance request. That's just more of a informational piece for you to know. So they plan to keep their existing fence, and again, that's the fence line shown in red. And then they want to add an additional 8-foot tall fence. And that 8-foot tall fence would be on the inside of the property, shown in yellow, and that would be an 8-foot tall electric fence. And so the reason they're keeping that exterior fence, which is made up of a combination of chain link fence and a masonry wall, is because of that electrified fence. The intent is not to put that on the outside where the public is, but to put that on the inside of the property. And so they've created, it's about a 1-foot distance between the existing fence and the proposed fence. And so again, the variance here is because the proposed fence is going up to 8 feet, which the code only allows 6 feet. This did go to Planning Commission back in February. We had 4 members present at that meeting. All 4 voted against the request. 3 were absent. The discussion revolved around making the variance findings, and there were some concerns from the Planning Commissioners that there was really nothing extraordinary about this site. Meaning, typically a variance is when you have, steep topography or an irregular shaped lot. None of those specifics were relevant with this case. It's a flat site, it's a square site, so that didn't really apply. There was discussion too that the variance request, that the variance findings does have some language that you can approve a variance if there's an exceptional situation or condition. So the applicant presented their case that in their opinion, the exceptional situation or condition was crime. And so they were trying to find a way to help deter crime. But again, the Planning Commission voted no. There was further discussion with the planning commission on. This is kind of a broader discussion. Maybe this should be something that is addressed in the zoning code update rather than through a case-by-case variant situation. And that is something that we're looking at as part of the zoning code update. It should be modify our fencing standards. But again, at this time, we are working with the zoning code that's in front of us now. So the planning commission denied this. The appellant, Michael Pate, filed the appeal. He is also working as part of the fence company. So he's representing the property owner on this. And he is here with a presentation. He can give you a little bit more detail about the specifics of the type of fencing he does and why this case, in his mind, warrants a variance in causing an exceptional situation. So with that, I will conclude my presentation.
Okay, thank you, Ms. Foos. Mr. Pate, why don't we give you a chance to get set up for your presentation? Ultimately, you'll have 10 minutes, sir. If you need it, certainly take all the time that you need, but let's make sure your mic is working and whatever presentational materials Madam Clerk has and can post them.
Okay, can you hear me right now?
Yes, very well. Thank you, sir.
Okay, great. First, I'll just go over an explanation of exactly how the device works. Basically, it is a 12-volt battery, just like the battery that is in your car. And what we're doing is we're checking an alarm. So we're basically running a pulsed electrical pulse down an interior wire back to an alarm panel to make sure no one has breached the perimeter. So we take a 12-volt battery, we amplify that 12 volts with an energizer up to 7,000 to 9,000 volts. Through the miracle of science, it takes about 1.3 seconds for that to happen. Once that energizer is loaded, it can no longer hold any more energy mechanically. It must release that energy. It releases it down the interior line back to the alarm panel. The alarm panel is looking for a nice clean return. A clean return in our world is about 2,000 volts or more. If it comes back less than that, it begins a countdown. Countdown, we're looking for 5 consecutive negative returns. If we get 5 consecutive negative returns, we set the alarm off on the site, audibly and also silently back to Columbia, South Carolina to our call center. We go through a call list. So let's say Angela Foos is number 1 on my call list. And it's 2:30 in the morning, we're going to call Angela at 2:30. And say, Angela, look, we've got a break-in on the northern perimeter, about 220 feet from the northeast corner. What do you want to do? Usually we also have cameras associated with these devices. So Angela could sit at home with her Wi-Fi, bring up that particular fence line, look at it and go, hey, we had a snowstorm, took out that big tree on the corner, knocked out the fence. Let's lock it up, guys. Go back to bed. We'll take care of it in the morning. Or I got 5 guys in a flatbed truck, cut a hole in my fence. They're robbing me blind. Please call the local police department. Get Reno over there right away and arrest these guys. That's called a verified alarm. Very safe device. We've got these all over Nevada, Las Vegas, North Las Vegas, right next door to you in Sparks. There are many of these devices all over Nevada. I've got more than 5,000 across the country. And we're really not an offense. We're an alarm system. So I think you have a little photograph up here with Marine Connection boat sales. I think I see our fence back behind there. You'll notice it's very difficult to see. We operate under the International Electrotechnical Commission standards, meaning we have to have our devices tested by a NERDL, a nationally recognized testing laboratory, to the standard. The standard basically says you have to have warning signs up on the fence. The capacitor can only hold 5 joules of energy. We have to have a Knox box or some sort of device for emergency personnel to get in there. And what we do is stop crime. And these particular businesses are vulnerable to crime. They have a lot of cars on the lots, and people like to break in and steal things out of the cars. So that's what we do. Caliber Collision is a great customer of mine, a great business in the city of Reno, and we guard lots of their lots, California, Nevada, Arizona, all across the way. So what we're looking for is an approval here. If you have any questions at all on how we operate, love to answer them, but it's a very simple device, and all we're trying to do is stop crime here and make sure that these guys can continue to operate.
Okay, Mr. Pate, thank you so much for that. I'm going to come back to my colleagues on the council, and let's see if we can take down the picture, Madam Clerk. Mr. Pate, if you could too, please try to speak directly into your microphone. We're recording this for posterity's sake, and just sometimes as you look around the room, it went out a little bit. So thank you for that. I'm going to go and start first with Councilmember Dewar. Councilmember Dewar, the floor is yours.
Sure. Thanks for doing the presentation. I have a better understanding. What I don't have an understanding about is what makes this an exceptional case. So our planning commission, who spent a fair amount of time on this, delved into the details. They voted that they could not make the findings, and findings was an exceptional hardship. In other words, I don't know that the crime next door property is any different than this crime. I'm sensitive to the issue of crime, and I understand why someone would want to protect their property. I have a camera on my site. I think cameras make sense. But I also looked at the backup materials, and I didn't see really any reports, a lot of reports. I saw some visits over the years, 6 years, but I didn't see any recorded thefts particularly, or maybe that wasn't presented. But I'm trying to understand where the hardship comes in. So my question is, why are all your neighbors, I'm very familiar with the area, Costco's over there generally. Why do we need a double fence? We have two kind of chain link fence, essentially one chain link and then one you're electrified. Why do we need those? Why do we need them so tall? You know, what is the extreme hardship that we would need to violate our code, I guess?
Well, we consider crime an extreme hardship. Caliber Collision is just like a lot of these businesses that basically self-insure. If someone breaks through the perimeter and messes up an automobile, even if they do have insurance, I'm sure you're probably familiar with this as I am. If someone nicks my car and I don't hit the deductible, I'm not calling my insurance company. That's a good way to get canceled. So a lot of these guys self-insure. They're not going to report anything to the police unless it's very, very, very serious. But we believe crime is an exception. Now, the height is fairly simple. If you think about 2 6-foot fences that are only 12 feet apart, even though ours is non-scalable, it's 20 strands of wire horizontal to the ground. If you have them the same height, someone's going to get on that exterior fence and just drop in because we're fairly close, somewhere around 8 inches to 12 inches or so, do their dirty deed. On the way out, the alarm will go off, but then it's too late. The cameras just augment what we do. Cameras record crime. They don't prevent crime. These devices prevent crime, stop crime cold. They're great for the neighborhood. They stop crime on adjacent properties. The police don't have to go out there, do an investigation, create a report, go through some more intensive patrolling on that particular property for X amount of weeks, 2, 3 weeks, then they're gone again. I mean, they have other things to do. They just cannot, you don't have the resources, and no one really does, to have the police on the spot all the time.
Right.
So we just look at it as crime being an exception.
Right. So everybody's got crime. I mean, I imagine that everyone in the neighborhood has the same level of crime. I mean, they have different businesses, I get that. But I guess where I'm struggling is, let's say that we did approve this, and then your next door neighbor wanted to do the same thing, and the next door neighbor wanted to do the same thing. Are we going to have a situation where we have a whole bunch of properties with 8-foot chain link fences that are electrified? I mean, in that general area, I mean, there's Costco, certainly, there's housing. I mean, I'm interested in hearing, I guess, from the ward representative, but I'm just not sure that unless we had an ordinance in place that spoke to kind of double fences, electrified fences that are 8 feet tall, I don't know that I haven't seen any material so far that says this is different than the general area. So that's why I'm struggling.
Well, it's not chain link, first of all.
So you said there's a chain link fence there already.
Yes.
And, right? And then this fence would be 1 foot inside that fence, right?
Right, right.
And it's 20 strands, I think you said.
Horizontal to the ground. You can't
Right.
even see it without the sign there.
Okay.
But just the picture you saw earlier, you can't even see the fence unless I actually pointed it out. It's,
Right.
it's very difficult to see unless someone's actually walking by the property and actually sees the sign. If you're driving by at a normal speed, 25, 30, 35 miles an hour, you are not going to see the.
Well, I guess a question for our staff is just, I mean, so would the regular chain link fence remain at 6 feet? That's the question I have for Angela. I think you still have on your mute.
Sorry about that. The applicant is proposing to leave the existing fence in place. And so that is a 6-foot fence. And then within a foot of that would be the 8-foot fence.
Okay, but the 8-foot fence is these strands, and its purpose is that it's an electrified fence, and its purpose is to, I guess, shock someone, I guess, that was trying to break in. Is that the idea?
Correct.
Yes, and it will shock someone if you get to it. And the shock is very similar to, let's say you've got stocking feet on, you're scrubbing across the carpet and go up to a door handle, touch it, you'll even throw a spark sometimes. That's a 10,000 volt shock.
Okay.
I'm less than that. Less than your stocking feet on a carpet.
You're talking about static.
Correct.
Okay.
Correct.
So, Angela, do we have other electrified fences or 8-foot fences in this configuration? Or is this like a first of? That's where I'm trying to understand.
Yeah, we tried to go back and find any evidence that we have approved something similar to this, an electrified fence. The problem is our code doesn't specifically regulate electrified fencing.
Sure.
So anyone can come in with a fence as long as it meets the standard, and it doesn't require a kind of special variance. If it was a 6-foot electrified fence, again, it would meet code.
Okay, thank you.
So that's the difference.
All right, thanks. Thank you.
I'm going to go now to our ward representative. Oh, wait, I see Councilmember Breckus, your hand is raised, so I'll come to you now. Yeah, now there you have it.
Okay, so my understanding of the variance is that all of the conditions or findings have to be met. And I guess I have a question first and foremost of the request. So, Ms. Foose, you just said if it was a 6-foot tall fence, there wouldn't be a variance requirement, right?
6 foot, except for in the front yard. The front yard would be 4.5 feet, would be the maximum.
Okay, so, well, there's 2 parts to it looks like the staff report mentions 2 components is increase the allowed fence from 6 to 8, but then also, what is this about in the side and rear yards not located on lot lines?
So, yeah, let me expand on that. The way our code works is as long as you put your fence, and I'm excluding front yards, as long as you put your standard 6-foot fence on the lot line, then you meet the code. Once you start encroaching outside of that lot line, then you don't meet the code. And in this case, their existing 6-foot fence is on the lot line, and that meets code. Except for their front fence, that doesn't meet code, but that's a separate issue. So their existing 6-foot fence that's there today meets the code. What they're asking to do is encroach and go an 8-foot fence, so that triggers 1 variance. And then where they're encroaching on the side and rear yards also triggers the variance.
Well, let me ask you this. When you say if they were on the lot line with 6 feet, that would be okay. But they're within that, they're within what's known as the setback, correct?
Correct.
And how far, what is the setback?
They are on their side and rear, I believe they are at 10.
10. So if they came 10 feet back and had it at 6 feet, we would be having this conversation.
Correct.
Okay. I see the applicant shaking his head.
Well, and the reason is I don't understand the term encroachment. Encroachment means you've gone past the lot line, not interior to it. In my mind.
We have what are known as setbacks.
Completely different than encroachment.
Well, okay, and I will agree with you on that. I think she means you're an encroachment into the setback, which is a no-build area. But I appreciate that. So when you get to the hardship condition, and I will disclose that I watched the Planning Commission meeting. I happened to be watching it that night and took interest in this. The hardship to me is very difficult because I just outlined two options of design that you could do. So to me, you have options. It's a self-imposed hardship. I don't want to, which is fine. But let me ask another question. If this is adjacent to an MF30 zone property, is that correct?
It is.
And is residential adjacency special use permits in play here?
It was not triggered. This was just a variance request, and so that this wasn't considered development in that sense, and so residential adjacency would be triggered with development. At this point, the public hearing then is for the variance.
Well, let me ask you this. This property, when it developed way back when, did it develop under a special use permit?
I would have to go back and look at the history of that. I don't know.
Okay, I think it probably did. And to me, the composition of our code is that when you're non-residential adjacent to residential, you need a special use permit. So I'm going to presume, the code says if you don't have one on record and went to the Planning Commission, you're presumed to have one. But I believe this property had one, and that's why you have that nice solid masonry fence around, because there was a desire with this residential adjacency to put this masonry fence around, and now we're coming back and redoing it all. So I'm still having a hard time with the hardship, but I also want to call out that I think if this is presumed to have a special use permit, which it is under the code, whether or not there's one on file, and we don't know, I think that it's a site that we put added, review to, and I would have liked to have seen that in that context, if we had a special use permit on record, because the masonry fence to me is a sign that happened. So.
Thank you, Councilmember Breckus. For my part, and so my colleagues understand where I'm coming from, this strikes me as very similar to an appeal we had several months ago, where it was the shape and sign and contour of a sign. And in that case, I will say the same thing I said here. Government is supposed to be here to assist our businesses. It is supposed to be, flexible to some extent and able to be, in as much as I believe that we should be encouraging our businesses to be successful, to thrive, to grow. If this is one of the things that this particular business owner believes is a necessary component of that, given the pictures that we saw and the very low impact that this has, I am supportive of what this owner is interested in doing, and believe, again, government should not spend its time standing in the way of small and minor things that property owners wish to do. And again, I analogize it to the sign example we had some months ago. I'm not going to stand on some of the other formalities on this particular occasion because I just think it's unnecessary, and I'd like to see our business community succeed in this regard. I'm going to go now to Councilmember, Jordan has raised her hand, and I'll mute myself. Councilmember Jordan.
Thank you, Vice Mayor Reese. And I'm glad you brought that up because I was having flashbacks of the sign issue. And I guess what I would ask staff is this one of those items that will get cleaned up for staff to be able to make these decisions and not have an entire council convene over these types of things in the future?
I think this is one of those areas that, frankly, this case brought fencing to light with the new zoning code update. So this is something I think that we will take a harder look at. And I think if council is interested in going that direction, we can definitely provide some allowances to increase height based on kind of some specific criteria.
Well, and I guess kind of where I'm coming from is it strikes me kind of like the sign issue for benefit of the applicant. We had a sign issue that was a couple inches a foot, 5 inches bigger than it was supposed to be, and it rose to the level of an appeal with this body. And to Vice Mayor Reese's point, I'm befuddled that we're sitting here talking about this issue. I guess that if you're trying to add a layer of security to the interior on your property, I'm having a hard time understanding why we wouldn't make an exception to our procedural process to grant that. So anyway, that's my 2 cents. I'm supportive of the applicant.
Thank you, Councilmember Jordan. I'm going to go first to Councilmember Dewar because I think this would be her second time, and then I'm going to come to Councilmember Delgado, in whose ward this is.
Yeah. Well, I am looking forward to hearing Councilman Delgado's input. I looked up the location again, and what concerns me is that we have an intermix of residences near the site. They are apartments, but they're not giant apartments. They're like 2-story apartments, and I imagine there are kids there. And it just, I have a pause. I mean, you know, we all bring something different to the table. I don't think that this is appropriate. I don't think it meets the hardship clause. And in this case, if we had an ordinance about electric fences, or we allowed something like this, we're talking not about 5 inches to the sign example, but we're talking about 2 feet, and we're talking about a second fence, a double fence, and we're talking about around an entire property. I voted for the variance for the sign. I totally get it. But to me, this doesn't fit in that category, but it's okay if others view it that it does. In other words, whether it's de minimis or not de minimis, it concerns me. I think we'll have a proliferation of these. I would rather have the staff propose something and have the applicant come back once we have, if we need a double fence ordinance or a 8-foot fence ordinance or an electric fence ordinance, any number of those, and I'd like to see it come forward personally before approving it. So that's just where I'm at. So it's no harm, no foul. We all just have a different take on it.
Thank you, Councilmember Dewar, for your thoughtfulness on that. I'm going to come to Councilmember Delgado.
Thank you, Vice Mayor. I do know this neighborhood very well, and I'm not, electric fences aren't new to me. I know them pretty well as well. I know they may be new to Reno, but they're not a new thing. Especially in Southern California, my time, and I've seen them in neighborhoods. And the questions that Mr. Pay was able to answer in terms of signage, the requirements of signage, and the bold pieces and everything else is something that it's an expectation and also a must in terms of just awareness. But that goes without saying. It's again something that I'm very familiar with. The idea of electrical fence right off the bat, I think, worries people because they just don't know what it is. But for me, not so much. I see this really as a business trying to protect itself with an 8-foot fence within the 6-foot fence that they have right now. And the code is really silent on this. But in talking to Mrs. Foose, there's opportunities for us when we move forward in terms of design or what that looks like in terms of criteria as they start to come out. But I too, I appreciate your concerns, Councilwoman Dewar, in terms of families and kids in the area. I know Worcester High School is further down south, not generally in the vicinity, but about 2-3 blocks down south from where this one is right next to the old Hometown Health by the car dealerships and other things. So it's a different neighborhood in terms of its density residential. But I can see where it was difficult for the Planning Commission to make their findings. But from my standpoint, I see the opportunities for us to be a little more broadened out, and I can see the justification in terms of a business protecting itself, and the code is silent on it. And the fence is not part of that. It's not part of the variance. So I'd like to make a motion to move to reverse the denial of the Planning Commission and direct for the approval of the variance.
Second. I have a motion Weber. And a second by Councilmember Weber, all open for discussion at this point. Councilmember Dewar, you have raised your hand. Thank you for that.
Thank you. I am not going to support it with all due respect, and for the reasons I stated, and just the fact that I can't make the findings. I understand, you know, where we want to go. I don't know that this is really where I want to go as a community, to look like Southern California or other places. But I understand over time things change. I get it. But I'd rather have the discussion. So this bottom line, I wanted to get on the record that I can't make findings A and B as outlined by the Planning Commission as well. Thank you.
Councilmember Breckus.
Yeah, I mean, along those lines is, number one, the variance findings are not as subjective as other things. And I know people feel bothered by being here and, you know, we're talking about 2 feet versus 8 feet, but where's the line, really? And, you know, staff recommended against this on the standards, not meeting the standards. The Planning Commission did. If it was more of a design review issue, I think there'd be more debate, but I just don't see an argument that, well, I'm looking at these hardships, irregular shape, and I can drive the car through that opening. I just don't see it, and I could elaborate upon that, but I think the staff report did that well. The second point, though, I think is along the commentary where it would be more subjective in a special use permit finding environment. And what our code does here is we have multifamily against our most intensive commercial. And within that community commercial district, we have your most intensive community commercial use. And those are hard edges. And the code tries to soften that with residential adjacency special use permits. Now, it's presumed to have one, but it's unknown if that was actually granted. The code says, as I mentioned before, if you don't have one issued, it's presumed to have one. But for me, in bringing a heightened fence, an electrified fence into the interior up against a residential property does signify some design problems of community character that would be more akin of the special use permit kind of considerations. And I think that is on the table, but I think more quantifiably, the findings of the variance just cannot be made. And I think it's a very poor signal for the council to allow anyone to come in and on inches or square feet, you know, right over those findings without a true address of how, you know, what the intent of those, how those findings are made, because they're not made. So I won't be supporting either.
Thank you, Councilmember Breckus. I don't believe there are any other council members wishing to add to the conversation, but before we call for the question, I'll ask Madam Clerk, were there any public comment?
Mr. Vice Mayor, there's no public comment on this item.
I asked at the beginning, but I just want to make sure because this is the moment where we would pause to ask for public comment. Seeing none, I'm going to call for the question. I have a motion by Councilmember Delgado, a second by Councilmember Weber. All those in favor, please signify by saying aye. Councilmember Delgado, I apologize.
We need to, I forgot to add as part of my motion to delete number 4 on the condition because it's directly in contradiction to the electrical fences, although the condition. Is that not right, Mrs. Please?
Yeah, let me just read the condition number 4 that he's referring to. Prior to the issuance of any building permit associated with a perimeter fence or wall, the applicant shall have plans approved that demonstrate any proposed fence is designed to be constructed with non-electrified conventional fence or wall materials for the first 6 feet in height. So what you're asking is to remove condition number 4, which specifies that the first 6 feet of the fence cannot be electrified.
So it would allow the whole fence to be electrified.
So yep, if that condition comes out, then it allows the fence to be electrified.
Okay. Thank you, Councilmember Delgado, for your clarification. Can I just ask the person who made the second, which I believe is Councilmember Weber, if that is consistent with your second?
Yes, it is. Thank you.
Okay, so I have a motion and a second. I'll call for the question. All those please signify by saying aye. Aye.
Aye.
All those opposed, please signify by saying nay.
Nay.
Okay, motion carries 5-2.
Mr. Vice Mayor,
Thank you, Mr. Pate. Yes?
I apologize. I'll
Thank
let you
you.
finish.
Appreciate all y'all's time today. Thank you very much.
Okay, I think, Madam Clerk, we're now at the time where we are done with our original time, but it looks like we're on item J, which is public comment. I'll ask whether there is public comment on any action item or general public comment that's been received at this time.
Mr. Vice Mayor, we received one public comment received after the time in which this meeting has started. It is general public comment received from Renee Johnson that has been submitted to the council, and it will be lodged as part of the record. With that, Mr. Vice Mayor, you have no further public comment, and we would be looking for a motion to adjourn from council.
Okay, may I have a motion, please?
So moved. Dewar.
May I have a motion by Councilmember Dewar and a second by Councilmember Weber. All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Good night.
Thank you.